Hello, hello. My name is Jill Osborne. I am the president and founder of the Interstitial Cystitis Network. It is Sunday, March 17th, 2019, and it is St. Patrick's Day, and it is time to do a regularly scheduled IC support group meeting. Now, my purpose in doing these meetings is to make patients so strong, so knowledgeable, so informed that you can take charge of your medical care so that nobody can mess with you, so that nobody can tell you that it's all in your head, so that nobody can tell you that there's no treatment, because that could not be farther from the truth. There is hope, my friends. There's tremendous hope for IC. One of the things that might really surprise you is we no longer think of IC as an incurable bladder disease. We don't. We think of it more as a pelvic injury or trauma because we now have these subtypes. There's one thing we absolutely can't agree with about interstitial cystitis is that a one treatment fits all approach does not work. Why? Why doesn't a one treatment approach work? Because there is tremendous diversity in the IC patient population. You got some patients with severe pain, others with no pain, both diagnosed with IC. Are they the same? Absolutely not. You've got some patients whose bladders are covered with lesions, others with bladders that are entirely normal, both diagnosed with IC. Are they the same? Absolutely not. So one of my goals with this meeting is to help you understand the variations of IC, give you hope, and really remind you that you are an anatomical mystery to be solved. One of the issues that I have with social networking and Facebook is when you go into a social networking group, you make the assumption that everybody's the same, and you might see somebody who's having an absolutely terrible time, but they may have untreated Hunner's lesions. You might have pelvic floor dysfunction. And until we really can understand and comprehend those variations, my concern is some of you are going to be scared. Alrighty, so hello, you guys. It's a gorgeous, my goodness, it's a gorgeous blue day here in California. Finally, after weeks and weeks and weeks of rain, oh my God, I'm wearing my St. Patrick's Day shirt because it is time to have a little bit of fun. Hi, Becky. Nice to see you. Hi, Sherry. Oh, yeah, I'm on. Hi, Tiffany. Nice to see you. Hi, Tabitha. Happy St. Patrick's Day, Tab. I went out to an ale house last night. I had little tiny tastes of ale because, you know what? We should talk about that. Seriously, guys, we need to talk about alcohol and IC. So let's just give it a minute and let some people come in, and then maybe that's what we'll talk about that a little bit. Let's see here. So if I'm looking upwards, guys, I'm looking at Facebook. If I'm looking downwards, I'm looking at YouTube. Alrighty. Just so you know, if you see my eyes wandering. Hello, Debbie from New Brunswick. I am sorry for your winter. Oh my God, you guys, for any of you back east, and especially in Nebraska with the flooding. Oh, I'm so sorry. I really hope that you're safe and warm. Hi, Jennifer. Hi, Donna on YouTube. Hello, my other visitors on YouTube. Hi, Brad, if you're watching. So let me tell you how we do these meetings. Okay, so normally I do about 20 minutes of educational content, then I do about 2 hours of questions, and then we usually do a free giveaway. And we already have our free giveaway set up for today. My free giveaway is going to be a copy of When It Hurts Down There by Dr. Angie Storr. So sometime during this meeting, if you stick around, you will have an opportunity to win this book for free. Alrighty, but you have to stick around for a little bit. I also really want you to understand that I'm not a doctor. I don't give you medical advice. Your job is to take the information I give you and vet it. Vet it, as you should be doing anytime you get information online, right? So if I say something that's really interesting, you want to explore it a little bit more, go read about it on our website, read some references, go to some other websites, credibility check it, and then take it with your doctor. All right. You have to understand. In fact, I'm going to tell you a funny story. when I started the IC Network 25 years ago, this was before Facebook, right? And so we have a very, very large mini Facebook on our website called the IC Network Support Forum. And in those first couple of years, people were sharing crazy, crazy stuff. Like one person said you could cure your IC by drinking lemon juice. Another person said you could cure your IC by sleeping on a magnet. Another person said a massive amount of colloidal silver. And it was making me crazy. That's crazy stuff, right? I mean, and so I was bemoaning my fate to Dr. Tony Buffington at Ohio State, who's one of the big national IC researchers, saying, you know, I couldn't make anybody happy. If I shut down the magnet guy, he was pissed off at me. If I shut down this person, they were pissed off at me, but I knew both of those were wrong. I'm not going to put those on my website. I'm not going to put those on the IC Network. And he introduced me to something called the Oxford Scale of Evidence-Based Medicine. And what he said, it's a very simple way of rating the quality of the information you get online. Okay, so let me just share it with you. An F is the opinion of a patient or somebody trying to sell you something. That is an F. So do you really want to make a $50,000 decision on an F rating? Probably not. If you have a limited budget, do you want to, you know, you've got $50 to spare every month. Do you want to base it on an F? Probably not. Okay, so an F rating, the least reliable source of information is information from another patient or information from a company selling you something. A D is the opinion of one doctor, not backed up by research study. A C is a preliminary research study. A B is a better research study. And an A is a double-blind placebo-controlled research study. All right. So again, as you're reading this information online, you got to, and if you hear somebody saying, hey, you know, try my fancy Chinese herb tea or trying this, you got to understand it's going to be an F. So you got to do your due diligence, my friends. You got to read up about it a little bit more, especially if your money is super, super tight. So let me get into the little teeny bit of content that we have. And then we're going to talk a little bit about alcohol because of St. Patrick's Day. Okay. So it's always entertaining. So here we've got this vast population of patients, right? I mean, I've got 50,000 plus members that are in my support group and many more. We work with about 200,000 patients a month over on the IC Network. So we have this vast archive of information. And 25 years ago, when I started it, I kept saying to the researchers, guys, mine us for information. We've got really good information to share with you. And it took kind of a long time for them to kind of respect the fact that we had good input that could help them understand IC. And yet I have to say, I still chuckle when I see research studies about things that we already know, right? And so many of you know that I am a huge fan of the MAP Research Network. That's a federally funded National Institutes of Health driven pelvic pain network that has been driving IC research for the last 15 years. It is a comprehensive, multidisciplinary research team. They have made fabulous findings, absolutely fabulous research breakthroughs with IC. They're the ones who discovered a couple of years ago, as an example, that many IC patients having flares actually have candida in your urine. That you actually might not be having a bacterial flare or a food-driven flare or a pelvic floor flare. We now know that some patients can have candida yeast flares. So we talked a lot about the MAP Research Network for many, many years on our website, and every magazine that I produce, it does it. So one of their research teams up in Washington decided to explore the concept of flares. Now, come on, guys, seriously. We've been talking about flares for 30 years. Do you not believe us? And the answer is, yeah, they believed us, but they really wanted to, I don't know, kind of prove it from an academic standpoint. And they published their information last month, and it is remarkably entertaining. So they had, and it's like, seriously, could you just come and talk to us? Right. So they worked with about 50 IC patients to document their flares over time. 96% of their patients had flares. Patients treated or managed their flares using a wide variety of strategies. Yeah. You know all that. So what were the flare triggers? Citrus fruits, tomatoes, spicy food, alcohol and caffeinated beverages, driving or sitting in forms of transportation, such as long car rides, long plane rides. I can attest to that. Urinary tract infections, stress. Hello, how many of us have stress-induced flares? All of us. And tight clothing. Okay, so yeah, so we knew that, right? But they found a couple of different flare triggers I've never seen before. So, again, I'm kind of chuckling that they're doing it, but it's useful information, right? They found that some patients flared wearing high heels or high boots. I've never seen that before. Or some patients flared after being exposed to certain perfumes or hair dye or toothpaste. Now, I can understand the high-heeled shoes because I think high-heeled shoes are brutal, and as a woman, I'm kind of always remembering that they were designed by men to make women look more attractive, but usually by pushing their tushy up. And I really don't think that that's necessary, right? I mean, we can just be people. But you think about it, if you're wearing the high-heeled shoes of today, imagine what that's doing to your pelvic floor. I'm sure that's triggering a pelvic floor flare. Hair dye is interesting. Of course, we know that chemical exposure can certainly irritate the bladder. And I don't know if you know this, but when you put nail polish on, the chemicals from your nail polish are almost instantaneously in your bloodstream. I think that, and so when you're looking at nail polish, you definitely want to get the more healthy, friendly nail polish rather than the more toxic toluene. I think they're toluene. I don't know. Toothpaste. I don't know about, I'd love to know what brands of toothpaste. And I swear I bought this article, but I can't find it. I thought I bought this last week. Every article costs $30. So, and then infections beyond the urinary tract. All right. So my friends, the moral of this research, if there's one thing we've learned from this research study is if you flare after wearing high heels, you're probably having a pelvic floor flare. So I would suggest that you lower your heels. Fascinating, right? Again, seriously, researchers, I don't know how much money they put into this, but they probably put in a couple $10,000 or more, $50,000, $60,000 doing this research study, where they could have done a simple survey, come to us on the internet and let us fill out this internet. And we probably could have given them even more information than that. But it's meaningful and it's appropriate. And the MAP Research Network is our best bet at finding answers for IC. So this is exciting, right? I mean, I'm excited. All right. So it's good old St. Patrick's Day, right? And so some people like to imbibe on St. Patrick's Day. I did last night, just a little bit. And so the question is, can IC patients drink alcohol safely? And the answer is it depends on your subtype. So if you've got, so remember we've got 5 subtypes directed towards IC, and I can go over those later if somebody wants to go through them in depth. If you've got Hunner's lesions, if you've got a bleeding bladder wall, if your bladder looks like this, the odds of you being able to drink alcohol are pretty slim, although there are some options. If you've got IC subtype 2 bladder wall driven, your bladder looks like this. It's going to have lots of little red wounds on it. Are you going to be able to drink alcohol? Tiny bit. If you are IC subtype 3 pelvic floor driven, are you going to be able to drink alcohol? Hell yeah. In modest quantities, appropriately so. And you've got a little beneficial side effect in that you've got a little muscle relaxant going on. IC subtype 4, pudendal neuralgia. Again, that patient's bladder is normally healthy. So the odds of them being able to drink alcohol is reasonable. And IC subtype 5, central sensitization, because our bladders are more easily irritated, the odds of us, myself, being able to drink alcohol are small amounts. Small amounts. We don't want to push it. So the question then is, what type of alcohol? So we did a research study several years ago where we surveyed, 1,000 patients, and to try to figure out what alcohols worked well for a patient. And what our study showed of the people who participated is almost everybody flared with alcohol to a certain degree. Granted, this was before we knew about the subtypes. But there was tremendous variety. So beer, for example, like I love a warm Guinness. I don't like cold Guinness. I like warm Guinness. I love the flavors of a warm Guinness. But unfortunately, the brown heavy beers were far more irritating than the clear pale ales. So if you're going to try a beer, go for a clear pale ale. I used to love Molson's Gold, but something kind of like that. What's the new one that's very seasonal? Well, anyway, there's so many craft beers out. It's amazing. So I wouldn't drink a whole one. I think I would just start with half of one, sip, drink some water afterwards, dilute the beer by drinking water, maybe use some pre-leaf. We know pre-leaf can reduce the acid in beer and alcohol, and I actually have the data from that to prove that. So if you're going to go for a beer, go for a clear pale ale. Now, in terms of wine, the challenge with wines is wines tend to be remarkably acidic. And so, but there are high acid wines and low acid wines. So if you, for example, like red wine, you want to go with a Merlot, something like that, or a Bordeaux blend, which is going to be lower in acids than some of the crisper, brighter Cabernets. Remember, acidity in fruit, what happens is as the fruit is growing, it is remarkably acidic. And if you buy an unripe grape, or an unripe apple, it's tart. That's acid. And as it hits that final maturation point where it's getting ready to eat, what happens is the sugars increase and the acids decrease. And so you want kind of a warm, summery varietal. So again, for if you're a red wine, try Merlot. If you are a white wine drinker, go with a Chardonnay, something like that. You don't want to do Fumé Blanc. You don't want to do those that are just sharper on the tongue. When they're sharper on the tongue, they're definitely more acidic. And then we come to hard liquor. So, and remarkably, in this research study, it was the hard liquors that were the best tolerated by IC patients, specifically clear liquors, sake and vodka. Sake and vodka turned out to actually be pretty tolerable in some patients as compared to a brown liquor, like a rum. But the cool thing about the mixed drinks is that you get to use a lot of mixers, and those mixers not only can dilute, they dilute and they reduce the acid level. So whatever you do as a mixed drink, or even with wine, do it on ice, so that as the ice is dissolving, you're getting great dilution. And then pick an icy friendly mixer. I don't want you to use Coke. I don't want you to use 7-Up. Maybe do a sparkling water, or, remember the old, the milk-based drinks? What were those? Pear juice, apple juice, whatever. Go for the icy friendly mixers. I would pass on the squeeze of lemon and instead do something else. If you want to have a martini, do an olive. An olive is completely icy friendly. All righty. So I hope that on today's wonderful St. Patrick's Day, that you will find somebody to kiss and that you smile today and that you have some fun today as we honor one of the great traditions in the United States and in Ireland. So it's time to take your questions. We've got a lot of questions happening on YouTube right now. Here, hold on a sec. So Carly on YouTube says, what advice do you have for pregnant women with IC, and is it possible ways to relieve flares? So Carly, over on our website, the IC Network, and so please come on over to our website, ic-network.com. You're going to find a pregnancy resource center, and that might give you some more tools that you can use. I will tell you that only one researcher has ever studied pregnancy and IC and provided some treatment suggestions, and that was Dr. Deborah Erickson at the University of Kentucky. And what she did is rated the risk of treatments during a pregnancy and on the fetus and stuff like that. I have a link to that on that page. It is not a free article. It wasn't free to us. I can't give it to you, but you can buy it. I would encourage you to buy it. It's like $20. Give it to your gynecologist so that you guys know what to look for. As an example, I want to give you a really, really clear example that she talked about. Sometimes when you have a flare, you're having a bladder wall flare, doctors want to do a rescue installation. It's called a rescue for a reason. It rescues you out of a flare. Normally, when you have a rescue, you walk out of the doctor's office pain-free. Okay, why? Because a rescue has heparin, which is a bladder coating. It's got lidocaine to turn the nerves off. It's got a little bit of sodium bicarb to help it pass through the bladder wall. Maybe a couple of other ingredients, steroid, whatever that doctor wants to put in there. The challenge with a rescue is the sodium bicarb. The sodium bicarb alkalinizes a formula which allows it to penetrate deeply into the tissue. And what Dr. Erickson said is we don't know really how far that goes, and we don't want to risk a fetus. So she said that if you're going to have a rescue, that you do not use a sodium bicarb. We do not want it to penetrate. We want it to be just confined to the bladder wall. So check our Pregnancy Resource Center. The other thing that we have over on the IC Network Patient Support Forum are 3 discussion boards dedicated to pregnancy, where you can read hundreds and hundreds and hundreds of other patient experiences, asking questions, answers. One of the big things is finding a prenatal vitamin, and that's IC friendly, because we know vitamins have a lot of vitamin C in it. Vitamin C is ascorbic acid. That's incredibly irritating to some patients. And yet, on the other hand, we have a low acid vitamin that would be more friendly, but it's never been tested with pregnancy. So you're really going to be dancing a dance. But I want to leave you with this, hun. Thousands of patients have babies all the time. You're going to be a great mom. I have no doubt about it. And the IC is not going to change that for you at all. And I absolutely wish you the best. And I want to give you a big, giant congratulations that you're going to have a baby. That's wonderful. And if there's ever anything that you want to talk about, something that funky that comes up, you know, you're absolutely welcome to give me a phone call. The IC Network, we have the only live patient support phone number, 800-928-7496. We take patient phone calls every day. However, we do have a pretty long queue now. So sometimes if you call, I won't be able to call you back for 24 hours. But if you have a question, please feel free to give us a call. Okay? Happy to help. All right. Let's see. YouTube, you guys are busy. Donna says when she does drink, she does organic wine or wine without sulfites, and that she can drink a little sake and a little Samuel Adams. Karen says, I started a flare Thursday night after eating a food I have eaten repeatedly over the last year and a half. Do you have any ideas why this would happen? So Karen, again, number one, we need to know what kind of flare this is. Is this a bladder wall flare or a pelvic floor flare? We know it's a bladder wall flare if you have pain as your bladder fills with urine that is relieved by urination. If you have pain after you're done peeing, we're going to focus more on the pelvic floor. So you have, depending upon your age, things happen over time, and your bladder just gets a bit more vulnerable because of the loss of estrogen. Or it may be this time there was something else a couple of days before or a day before that kind of tweaked your bladder and made it a bit more vulnerable to that food. And I would say that that's probably what's happened, is your bladder had already been traumatized a little bit. Okay. Donna says she's organic vodka. Karen says she has a very limited diet and noticed that she's starting to have problems after tilapia, and it started to use Pre-Leaf. You guys, tilapia is of all of the fish, the dirtiest fish, because it's a bottom feeder and it's really well known to be a pretty cheap kind of icky fish, even though it tastes good. It wouldn't be my first choice for fish. Cher says Kahlua. Yeah, I was thinking of Kahlua and cream as one of those milk-based drinks. How can a person with IC do a liver flush? I don't know what that, a liver flush? Hun, I don't know what that is. Pucky, you'll have to fix that. All right, let's go up to Facebook here. Now, you guys, listen, if I miss your question, please don't take it personally. They just scroll by very quickly, and Facebook in particular really messes me up because sometimes it doesn't let me scroll back. Christine says she's pretty much bedbound, hun. I'm so sorry. And I would love to help you. Let's see if we can figure out what's going on with you and what subtype you are. Dawn says, was just diagnosed on Tuesday, have your cysto with hydrodistension on April 4th. Been fighting pelvic pain, pelvic floor dysfunction for 10 years, hematuria for 5 years. Now they think it's IC. All right, Dawn, girl, you have come to the right place. So a couple of interesting points for you. I'm really glad that you're having the hydrodistension. Because, you know, I think, let's see, how do I want to say this? If your symptoms were brand new and you didn't have this 10-year history, and let's just say started last month, I would say it's not time for a hydrodistension, you know, because that's when we have to rule stuff out first. Why go in and be aggressive to your bladder when there are other things that we can do that might be help? But the challenge for you, my dear, is that you've been bleeding for 5 years and that you have had pelvic pain for 10 years. It is high time for you to have a hydrodistension. We got to get in and look at that bladder, but I want you to check on a couple of things. In the old days, hydrodistensions were high pressure, long duration. What that meant is that they filled the bladder up a lot, and then they kept it there for a long period of time. They really, really stretched the bladder. And unfortunately, you know, the bladder can rupture. And you've probably all heard stories of people driving across country. They don't stop to use the bathroom and their bladder ruptures because it gets too full. So when the American Urology Association created their new guidelines for IC back in 2011, they specifically said high pressure, long duration hydrodistension should not be done. Instead, we're doing low pressure. So instead of big or like this big, short duration, so that we're not traumatizing the bladder, because that indeed is the entire goal of the American Urology Association, is to not traumatize you, the patient, like we were all traumatized 20 and 25 years ago. So number one, let's make sure that they're going to do it the right way. Low pressure, short duration. I will tell you, I had one almost a little less than 2 years ago. Piece of cake. Piece of cake for me. Granted, I was on pain meds because I'd had a hysterectomy at the same time. So maybe that's not a fair thing for me to say. But anyway, the low pressures are much, much easier. Now, the second thing I need you to really be clear on is, what is the doctor going to do if he finds something like lesions, which I suspect you probably have, given the fact that you have hematuria. You might have Hunner's lesions. You need to make sure that he or she is prepared to treat you at that time. It would be a tremendous disservice to you if they did nothing, because you would then have to have another hydrogestension sometime in the next couple of months to have it done properly. If they find Hunner's lesions, the lesions need to either be cauterized or lasered, or they need to be injected with a steroid. Okay. And those two things, Elmeron, bladder instills, all that other stuff does not work for lesions. What works for lesions is lesion-specific therapy. And so you need to have a discussion with him about what is he going to do if he finds lesions. And if he says nothing, I say go to another doctor, because that would be a tremendous waste of time and money for you, you know, because surgery costs money, right? The third thing about a hydrogestension is that what's the right word? Nosocomial infection is possible. So whenever you introduce an instrument into the bladder, bacteria can be introduced to the bladder. So there is a small subset of patients who have a hydrogestension. They get home, and about 3 days later, 4 days later, their symptoms get much worse. And that's because they've had developed a hospital-acquired infection. And so that's why I don't really like people having hydrogestensions on Fridays, because that means the doctor's not available on Saturday and Sunday. I think it's good to have it on a Monday or Tuesday. So you've got that whole week to communicate with that doctor if something happens. So if you notice your symptoms get worse, definitely call the doctor, make sure that they give you an antibiotic. And then last but not least, well, two things. Your urethra, the first couple of times you pee, whenever you have a cystoscope inserted into your urethra, are not going to be the funnest thing in the world. That is very temporary. It should be gone within 48 hours. But the first time that you pee afterwards, I would recommend drinking a big glass of water, waiting till your bladder's pretty full, going and sitting on the toilet and just letting it fly. You just gotta bite your lip and let it fly. If you try to dribble it out through a sore urethra, it tends to hurt a little bit more. Whereas if you just bite your lip and just pee, you kind of get over that pain more quickly. And again, that will resolve very, very quickly. And I would hope that they would give you a couple of pain pills to take with you if you need them. I'm not saying 30 pills, but I'm saying 5 pills or 3 pills that you can cut in half, so that especially for that first night might be a little bit uncomfortable. And so using a little bit of pain medicine afterwards is reasonable. Patients generally respond very, very well. Now that we're doing the low pressure, you should be feeling good within a week. I wouldn't expect to be able to go back to work the next day, though. I think that would be pushing it. All right. You're going to need to rest. Got to put your feet up, heating pad, chill out at your home, watch some really good movies, read whatever books you want, and just rest. But you'll do it because millions of patients have done it, and we are all living proof that you can get through it. And it's good, valuable information. You know, I get very, very frustrated with patients who they've gotten worse over time. They know they've gotten worse over time, but they won't let the doctor look. So you're asking the doctor to guess. And guessing is a guess. It's no substitute for eyeballs on the organ. There comes a point in time when you need somebody to look at your bladder to make sure there's nothing funky going on. And I've told this story many times. We had a patient who had symptoms for several years, and she didn't want the doctor to look inside her bladder. And then she finally gave it up last year and said, all right, take a look. And you know what they found? It was stunning. What they found was a giant kidney stone, like this big, floating around in her bladder. Now, kidney stones are really sharp and they cut. So here you've got this stone going up and down as urine's going in the bladder. And bam, her bladder wall was getting cut over and over and over again. So when they broke it up and got rid of it, guess what? Her bladder healed and she's good. So again, that's another reason why you want to let somebody look. All righty. Hi, Christine. I can see you. Joanne Marucci says, how helpful are urodynamics tests? You know, a urodynamics test is a routine diagnostic test designed to test how your nerves are functioning in your bladder and in your urinary tract. Basically, you lie on your back, you've got a catheter inside of you or a specific device. They slowly fill your bladder with fluid. And then they say, tell me when you first feel the need to urinate. When do you first feel that need? And then you'll go, okay, now, I feel it now. And then they will continue to fill it. And they will say, tell us when you first feel discomfort. And you're laying there going, okay, I feel it now. And then they'll push it just a wee bit farther. And then they stop. And it's important that you have very clear communication with your doctor. And if it hurts, you tell them so that they stop, because the goal here is not to hurt anything. There has been a lot of research and debate about urodynamics, and is it helpful for a diagnosis of IC? And according to the American Urology Association, it really is not. However, it is useful in situations where a diagnosis is in doubt. So if the doctor isn't quite sure what's going on with your symptoms, then having a routine urodynamics is reasonable, but it's certainly not part of that basic initial diagnostic workup. And you can, you know, I always tell everybody, like, seriously, I want you all to go to auanet.org. That's the American Urology Association. In the upper right-hand corner is a link to guidelines. I want you to click on the guidelines, go to that page. Then I want you to search for interstitial cystitis. And then I want you to print out 3 copies. It's 60 pages long. It will be the best thing you've ever printed off of the internet. 60 pages long. One for you. You read it and absorb it, and it is your weapon. It is what you can use with any doctor who doesn't know what he's talking about. You can whip out the guidelines. Number 2, print out a copy for your primary care and your doctor. And number 3, carry one with you so that if you ever have to go to the emergency room, you can give that to the provider so that they know what the hell they're dealing with. All right. So you can get more information on urodynamics test and its validity in the AUA, American Urology Association guidelines. Hi, Cheryl. Hi, Donna. Hi, Charlene. Hi, Sherry. Sherry is going to do some pelvic floor physical therapy. I like to see that. Hi, Brittany. Hi, Marilyn. Leslie says, I've had an IC for a long time, having a flare like you've not had in a decade. With the Elmeron concerns, my MD suggested Cystro Protect. However, it caused me GI upset several times, so now I'm not going to take it. I've heard aloe is irritating, so also doing PT. What are the other options? Can you have pelvic floor pain and it's not IC driven? Yeah, you can. You know, patients get stuck in what I call the chicken versus egg cycle. Which comes first, the chicken or the egg? And for us, it's which comes first, the bladder or the pelvic floor. The odds are they're both involved because they're so incredibly interconnected. I mean, here you got your bladder and here you got your pelvic floor, right? But one is generally driving the other. And that's our challenge here, is to try to figure out which is dominant, which is primary, and which is secondary. So for some patients, the bladder wall gets irritated by, let's say, chemotherapy or drinking coffee or soda or something like that. And so here you've got a bladder wall that's pulsing. And, you know, I don't know why that's shining. That's weird. Okay, so here you've got a bladder wall that's pulsing in pain, and your muscles get tight to protect them in a guarding reflex, right? the therapeutic priority for this group of patients with bladder wall-driven symptoms is to calm and soothe the bladder. If we calm and soothe the bladder, the muscles should release and everything will release. But consider the opposite. What if you're one of those patients whose symptoms began after a trauma, like falling on your tailbone or having a baby? So here you've got a healthy bladder and you've got your muscles, and bam, they get hurt. They get hurt. So, and that's like the wrong way to do it. So what happens with a muscle that gets hurt is it gets very flaccid and weak, right? But it has a job to do. It knows it's supposed to support the bladder, so it overcompensates by getting tight. It's the guarding reflex, right? So here we have a healthy bladder, but wounded, injured muscles. Now, you probably have no freaking clue that you have a muscle injury. And your first sign of a problem is, in fact, frequency urgency. So here you've got this typical patient. They've got frequency urgency. They think they've got a bladder infection. They call the doctor. The doctor goes, yeah, it sounds like you have a bladder infection. They give you an antibiotic over the phone. It does not work. You call the doctor back, say it didn't work. You come in and you give a culture, and your culture is negative, right? Because there's really not an infection. Then the doctor goes, well, maybe you've got overactive bladder, and they throw the overactive bladder medicine at you. Those don't work. Then they might say you've got interstitial cystitis, and they throw Elmeron and hydroxyzine and amitriptyline at you, and those really don't work, and you don't get better. And the reason why is because the bladder is not the target organ here. If the bladder is the victim of very, very tight muscles. So our therapeutic priority in this group is to release the muscles. When we release the muscles, the bladder then gets the blood flow that it needs to be healthy. And that's the largest subtype. We think that's now the largest subtype, but not only for women, but also men diagnosed with chronic prostatitis. And the secondary effect of tight muscles is that, you know, this is the only muscle group that controls major bodily functions. How you go to the bathroom, whether you urinate or you defecate, or for women, if you're having sex. Well, and men too, just different way. So if you've got tight muscles, you're probably going to have constipation. It's probably going to be hard for you to start your urine stream. You got to sit there or stand there 5, 10, 15, 20, 30 seconds to relax enough to empty your bladder. Some of you might turn the water on, you know, to find ways to do this, not really understanding that it's really your muscles that are the problem here. And that's why sex is painful. If you got tight muscles, getting a penis up there, are you kidding? That hurts. And for a guy, if you got tight muscles, ejaculating hurts. So it's all about restoring blood flow. And we do that properly with physical therapy. We've got to work with those muscles. This is not, I mean, yes, you can do muscle relaxants, and that's a really good experiment. But in the end, so look at it this way. Okay, so let's just say this is a tight muscle, right? Here's a tight muscle. What a physical therapist will do is they slowly, slowly, slowly use their hands and try to get it to the proper length and texture. So you're going from this to this, right? And it takes time. If you go to the physical therapist and you have your pelvic floor assessment and they touch something and it hurts, that is a tremendous victory. Because hello, we found it. Holy hell, we found it. We found the cause of your pain. Do not be afraid of pain at that first appointment. If they touch something and it hurts, you need to have a giant smile on your face. Because then you're going to say, all right, what the hell did you just touch? What was it? Was it my piriform? Tell me what it was, because now we know the area that you need to be doing your work in. Quite a few people have issues on one side or the other side too, which is interesting. My pelvic floor issues are on my left side. And you know what's so interesting? I got to tell you, you know, because like I have no shame. I'll talk about anything. So I had the hysterectomy 18 months ago, and they tore the top of my vagina where my cervix was. And it was 10 months of agony before the physical therapy fixed it and stretched it out, right? And yet the other day, I could feel it getting tight again, and I could feel it, and it felt like a tight piano string. And that's what doctors have been saying for years. If you go back 30 years ago in the journals, you'll see doctors describing, I see patients with muscles so tight, they feel like tight piano strings. And by golly, I felt that the other night. I was like, holy moly. Like I wish I could look in there, but you can't. All right, let's go on. Hi, Harriet. Cheryl says, why does normal saline cause you to go into a flare when you're in the ER? Because it's salt, hun. Salt on a wound hurts. That's why we want to do DI water instead. We want to use a sterile water rather than a saline solution if at all possible. Evelyn, the lady who helped me start my first IC support group, may she rest in peace, she has passed on, used to do home installations. And they went perfectly for her for a couple of years. And then bam, the latest prescription just killed her bladder. And it was because they put saline in it instead of water. Okay. So saline can be irritating for some of us. Harriet says that she is drinking Tyler's acid-free coffee. You can drink coffee again. You guys, yeah, there are low acid coffees available. And in fact, I have, here, hold on. I've got some samples here. In fact, I just brought some up from our warehouse last week. All right. So you want to see the low acid coffees? I will show them to you. Simpatico low acid coffee is probably one of our best sellers. It's something that I see patients have been using for around a decade. It's very interesting. So they've got a decaf and a regular. Coffee acidity is controlled by the altitude that it's grown in, when it's harvested, and how it's roasted. So we want to do an air roast rather than a metal can roast because the heat of the bean on the metal causes certain acids to develop. So it's all about roasting and all that sort of stuff. So you got Simpatico. You've got Tyler's. And we now have K-Cups. Tyler's is the only low acid coffee that comes in K-Cups. And here's another Tyler's. But my favorite, and the one that we often have samples of, is Bella Rosa low acid coffee. This actually has the lowest level of the specific acid that irritates the stomach and the bladder in the industry by far. So the lowest acid coffee is in fact the Bella Rosa. We have decaf, half calf, and regular. Let's see, is there anything else in here? I have these for video production. These are my samples for videos. Of course, for tea drinkers, we want you to be drinking a chamomile herbal tea. That's absolutely going to be the most bladder friendly. And the tea that I drink almost every day is this tea, which is Harney & Sons Rooibos Pumpkin Spice Tea. I tell you what, my friends, I don't know when these expired. That's my problem. Otherwise, I would give them as freebies, but they're sitting here as demos. Let me see if I can find an expiration date on one of these. All right. I tell you what, let's do our first freebie of the night because it's St. Patrick's Day and I want to have some fun. Here is our freebie. How would you like Tyler's acid-free decaf K-Cups. I'm trying to think how to do this. Okay, so whenever we do this, the problem is I have to scroll way down and I'm going to lose questions. Dang it. Dang it, dang it, dang it. Okay, I'm going to do some more questions, but just so you know, we're going to give away one of these too. So if you're interested in getting some coffee, stick around. All right, so now we've got 2 freebies to do. All right. Leslie says, doctors have never discussed subtypes with you and they are IC specialists. So Leslie, subtyping or phenotyping is very new. It's really only being discussed at literally the top levels in the IC research movement right now. There's probably 10 doctors around the world that are subtyping. The vast majority of doctors don't even know that the subtypes exist. But what they do know, so if you don't have to use the word subtype with them or phenotype with them, but what you can say is, I mean, just understand in your brain that there are these variations. So, doctor, do I have Hunner's lesions? Do I have bladder wall? Do I have pelvic floor? Do I have pudendal neuralgia? Do I have central sensitization? There you go. But, you know, you have to understand that probably 95% of urologists out there are not connected to the ICU research movement like I am and like we are. And so it's really the top doctors, the Ken Peters, the Robert Evans, the Rob Moldwins, the Phil Hannos, the Chris Paynes. Those are the ones that when you go to their office, they're always trying to categorize you. You know, and they may even have another subtype, because we don't have an agreed upon subtyping system in the United States. There are 16 variants of IC in Europe. There are 6 in Canada. There's no formally agreed subtyping system in the United States. However, I use a system that was created by the doctor who ran the IC research program at Stanford University. He created it 4 years ago, and it is, in my opinion, brilliant, and it's working beautifully. We have links to articles on our website. We have a freebie in our download area. We have a whole free download area on our website. I've got fact sheets on the subtype that you can download that doctors are downloading also. So it's not surprising that they don't know about it, but it's important that you know about it so that you can differentiate here. So if you've got dominant pelvic floor dysfunction and the doctor says, well, I want you to take Elmeron, you're like, why? Why would I take a bladder wall treatment if my problem is my muscles? Or if you've got Hunner's lesions and the doctor wants to do InterStim, you're going to say, why? Why? I would like my lesions treated correctly before you do a treatment that could cost me $100,000, right? So it's, you know, you just got to understand this. All right. Maria says she wishes she could drink citric juices and do the, I don't know what the lever flesh is. I'm sorry. Citric juices, citric acid is by far the most irritating acid. Oh, and you know what? When we were talking about alcohol, I totally forgot to talk about hard ciders. That's what I drink. I like a pear or an apple hard cider. And that's what I had last night. I had about this much and I was fine. I was fine. So look at the hard ciders. If you don't like beer and the wine isn't irritating for you, look at the hard ciders as an option. But for God's sake, do not get pineapple or lemon or orange or blood orange. You got to get pear or apple or a berry and give that a try. See how you do. Again, on the rocks, follow it with water. That's what I do every time. Low acid orange juice, it actually irritates some people. I certainly wouldn't recommend it for people with Hunner's lesions. Jennifer says she's been in a flare for 3 weeks, roughly around the same time your doctor put you on birth control pills to stop the flares during your cycle. Doctor says this flare is not from birth control pills. She then put me on amitriptyline for the pain. I'm so tired and still in pain. How long does it work? So, hun, amitriptyline is not a pain medication. It is not a pain medication like codeine. What amitriptyline does over time is kind of just slowly calm nerves down. And that's probably not completely pharmacologically correct, a way of saying how it works. But one of the mistakes that patients sometimes make is they start thinking that amitriptyline is like aspirin or it's like pain meds. And it's like, if I have severe pain, I should take 2 or 3. Please do not do that. Amitriptyline is a harder medication for patients to tolerate. It has a lot of potential side effects. I, for one, had arrhythmias from it. I took it for 3 months. It took, I don't know how long for my heart to calm down after that, or a heart monitor for a month, all from taking amitriptyline. It can cause dry mouth, dry eyes, and most of all, weight gain. When you take a medication like that, you end up craving carbs and you start snacking all the time. Amitriptyline has also been linked to cognitive decline over time, especially if you're taking a lot of it, even in young patients. So it has a place. Using a little bit every day is perfectly reasonable. It's very important that you not take a lot of it. You want to try, normally, again, if you look at the AUA guidelines, look at their dosage requirements. Most people start at 5 milligrams of amitriptyline. I never went above 10 because you're not taking it for depression. You're not going for the 75 dose. Most BIC patients stay at a very, very low dose. You know, there's such a thing as, you know, the irony here is that it happened at exactly the same time that you changed your birth control pills. And we know that the bladder is remarkably influenced by hormones. And so I think that that is worth having another discussion with your doctor about that. Because I do believe that there is a hormone subtype. I do. We've just never been fleshed out. But in 25 years, I will tell you, I've worked with a lot of patients who have issues when birth control gets stopped, birth control gets started, whatever, or premenopause or whatever. When they get their hormones stabilized, things improve dramatically. So, you know, we got to finesse this flare, my dear. Is it a bladder wall flare? Is it a pelvic floor flare? That's question number 1. If it's pain as your bladder fills with urine that is relieved by urination, that's pointing to your bladder wall. If it's pain after urination, that's pointing to your pelvic floor. You look at your diet. Let's make sure there's nothing else irritating your bladder. Nothing, you know, you're not drinking coffee every day, soda every day, or even 1 coffee a week would still irritate that bladder. And see if we can finesse that. But inevitably, there might be a time when you might need to stop the birth control for 2 weeks and see if it's the birth control pills. But again, I'm not your doctor. I'm just giving you context. You need to have that discussion with your doctor. You know, guys, you got to remember, listen, if a treatment interferes with your quality of life, like Elmiron, if you're taking Elmiron and it's giving you explosive diarrhea, are you going to keep taking Elmiron? Well, I would hope not. I would hope not. People have different tolerances for medications. And so it's about finding what will work for you. And it may be that that brand of birth control, whatever, the type of birth control is just not working with your body, hun. I think you'll figure it out, though. I do. Joanne, how likely is it that a person with IC is having underlying problems with their kidneys? We don't have any research that's made a connection at all that I'm aware of. Marge, can a flare cause pain going down the legs? Yes, tight pelvic floor muscles can squeeze the post-tibial nerve, the tibial nerve, which can then cause shooting pain down the legs. So that is, yes, I would suspect that that is something like sciatica due to tight pelvic floor muscles and or sitting too long. Rocio says, what kind of fish? I am so not the person to ask. A wild-caught salmon, cod, but I'm not a fish girl. I'm a terrible Norwegian. You would think I would like it, and I wouldn't. Luana says, my urethra burns every time I pee. I have no infections. The tests say I've had this for 8 years. Just had a hysterectomy because of uterine cancer. That's what I had. 19 months ago, Luana, so you are not alone. So did the urethra burning start before the hysterectomy or after the hysterectomy? No, you just said, no, you said it was, you've had urethra burning for about 8 years. I have a blog on our website called The 7 Causes of Urethral Pain. I want you to go over to the IC Network and I want you to read that blog. But there are a couple of things that I think are worth ruling out. Number one, estrogen atrophy. The urethra is the first part of the urinary tract to react to the loss of estrogen. You know, you have to remember that your urethra and your bladder and your vulva and your vagina are all part of, for you nerds out there, the urogenital sinus. What that means is that when you were just a couple of cells in your mom's belly, there was one cell that diversified and created all 4 organs. And they are all mucous membrane covered organs. And this is a good 3-dimensional look at what a mucous membrane looks like, especially the bladder wall. So we've got a layer of mucus. We've got a layer of 4 to 5 urothelial cells. And then, of course, we've got nerves and blood vessels down here. This mucus plays a very, very important role in bladder and urethral health because it acts as a barrier. It keeps irritating substances from your urine from reaching your skin and doing damage down here. But guess what? This mucosal barrier is estrogen dependent. What that means is when you're young and you have lots of estrogen, you have lots of mucus. When you're older and you have less estrogen, you have much less mucus. As a result, your mucosal barrier's thin and urine can now get where it should not be. It gets down into these tissues where it starts triggering all sorts of bad things happening, inflammatory process, irritation, all that sort of stuff. So, Luana, the first thing that I would be looking at, honestly, is estrogen atrophy. For me, it started when I was 51. So weird. I feel 25. It is baffling that I am now well into my 50s. And it would never have dawned on me that I would have an age-related hormone issue, as my doctor confirmed 3 months later when I went in crying and saying, what's wrong with my urethra? And he goes, well, didn't you use a hormone cream I gave you? And I went, no, didn't think I needed it. He goes, oh, you needed it. And then he explained that the urethra is remarkably sensitive to the loss of estrogen. The other thing about the urethra that's interesting is your urethra is about the size of your little finger. Halfway up is a little gland, a little sea sponge that kind of wraps around the outside of it. It's called the periurethral gland. It is the female prostate. It is what we call a homologue to the male prostate. If you look at the cells are almost identical. Granted, it's a different shape, different location, but the cells are very, very similar. And like the male prostate, the female periurethral gland can become infected. And it can become stagnant. And even though it's a very small gland, it becomes like a deep, painful pimple. But you would know because if you were trying to have sex, as a penis was moving up your vagina, it would hit that pimple and it would hurt a lot. So, or you can put your finger in your vagina and gently touch the front side of your vagina and see if you have any deep bumps, painful bumps. That would be an infection of your periurethral gland. Also understand that the urethra is remarkably sensitive to chemicals, especially if you're of a certain age. So mini pads, laundry detergent. If I put on a pair of underwear, wash and shear, tied within 5 minutes, I'll have urethral burning. And I had that 20 years ago before I was menopausal. So we want to look at laundry detergent. You want to use a free and clear, rinse twice. You cannot use any fabric softener. You cannot use any laundry sheets. Your bath soap should be a plain unscented Dove bar or a Basis skin bar. You got to be very careful of liquid soaps. So we got to rule out the chemical sensitivity too, hun. Okay. So go read that. And if you have any questions, feel free to give me a call. Tony says, have you heard about the product Intrarosa? It's a pharmaceutical vaginal DHEA suppository that converts to estrogen and testosterone. She says she's been using it and it seems to be helping your bladder, but you wondered how it would compare to an actual. Hun, you'll have to look at the research for that. I'm really glad that it's working for you. I will tell you though, we're getting patients that are struggling with intrarosa, that it's provoking them. And that's kind of, again, that just whole individuality of IC. So if it's working, power to you, girl. I use a plain compounded estrogen cream myself. I don't use testosterone cream. Patricia says she developed urethral pain with kidney stones removed and 3 stents. Doctor wants to do a cystoscopy in the office. So kidney stones are very sharp and they will cut tissue, but tissue normally grows back fairly quickly. Within 2 weeks, a cell is usually replaced in the bladder. And I'm not sure what the timeline is for the urethra. But if you're still having urethral pain, having a plain cystoscopy in the office is, in my opinion, very important. You got to get eyeballs on the organ, try to figure out what's going on, see if it's, if you've got any residual cuts in it, if it's narrow, if it's scarred, anything. I mean, I think that's reasonable. But again, go look at my article, The 7 Causes of Urethral Pain, right on the IC Network website. Just search for it. Search for it. The 7 Causes of Urethral Pain. Just search for urethral pain and read that and see if that helps at all. Mini pads are well known to be irritating. Nicolette says, how do you adjust to exercise limitations, no longer being able to lift heavy weights, doing abdominal exercises? Well, hun, if you got pelvic floor dysfunction, you're hurt. You're hurt. And so once your muscles are rehabilitated, you might be able to go back to doing that. But you have to remember that over time, as we get older and we lose estrogen, our muscles tend to get weaker. So what that means then is the exercises that you used to do in your 20s and 30s that you love doing, you might not be able to do in your 40s and 50s. It might be a little bit much for your estrogen weakened body or muscles. So for me in my 20s, what I would do when I worked out is my favorite workout was swimming a mile, and then I'd go into the workout room, I'd do 100 flights of stairs, and then I'd go row 5 miles. I was a nut. I'd work and go work out. No social life. I just work and go work out. I can't. Number one, I won't swim because of chemicals. I won't do Stairmaster because I really think I was so excessive. I really hurt my muscles. And that's why they think I have left side pelvic floor dysfunction from all the stuff I did in my 20s. It was ridiculous. I just love working out, loved running up hills. Hello, Kirsty from the United Kingdom. Listen, normally we have IC patients from New Zealand. And if you are here from New Zealand, I just want to give you the biggest giant hug that I could possibly give you. And I'm so, so sorry for what your country and what you are going through. And just know that every IC patient around the world is sending you lots of love and strength and courage during these very, very difficult days. We've been through it far too many times ourselves, and it's rough. Talk to people. If you need help, ask for it. Use those crisis support services. And just know that love, every day is precious. Love everyone that you can possibly love. Being as kind as you can possibly be is, in my opinion, the way to live. And I'm going to tell you right now, I love your Prime Minister. Can we copy her and bring her to the United States? Sorry, I don't want to get political. I try not to get political on these websites. On these streams. Hi, Rhonda. Kathy has some eye issues and is wondering if it's from Elmeron. She had scar tissue removed from both eyes. Kathy at the Emory Eye Center is will be publishing several more papers. They are now studying many more patients that have been referred to them. And I don't know, I don't remember seeing scar tissue in their study of Elmiron-induced eye damage. But that doesn't mean that that's not going to become one of the possible findings. Still early on with the Elmiron research. Hi, Gwen. Yes, I do see you on YouTube, hon. I'm working on both. If I'm looking up here, if I'm looking upwards, I'm looking at Facebook. If I'm looking downwards, I'm looking at YouTube. Christina on YouTube makes a very, very important point, and that is she was extremely sensitive to the cysto, so her urologist did it under twilight anesthesia, and that is an excellent suggestion. Excellent, excellent suggestion. Little tiny bit of propofol, little tiny bit of Versed. I always tell the doctor if I have to do something like a root canal, something like that, it's like, or a colonoscopy, I just say, listen, this will be a success if I have no memory of it. None. If I have no memory, you have done your job perfectly. So I'm all for twilight anesthesia. Rhonda's asking, any new research with stem cells to help the bladder? Your bladder's like leather, can't expand it anymore. Let me look. Hold on a sec. I seem to remember seeing something in the last month or two. I just didn't catch my attention. I'm sitting in front of two computers right now. I don't know if you can see. Well, the Chinese are saying that umbilical cord-derived stem cells alleviated inflammation and inhibited damage in the bladder. Hun, I want you to go to PubMed. That's where I go, the National Library of Medicine, PubMed, P-U-B, P as in Paul, U, B as in boy, M as in Mary, E, D as in dog. Go to pubmed.gov, G-O-V, and search for interstitial cystitis stem cell. I mean, I just did it, and there are 57 links to articles that talk about stem cell therapy with interstitial cystitis. Oh, and here we go. Whoa, 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 whoa. Hold on one sec. Hold on. Okay, hold on. Hold your horses. Edit, find. So, a stem cell study for women with stress urinary contest actually won Best Poster Award and was highlighted at the American Urology Association. Oh, actually, no. Actually, no, just it wasn't highlighted. Carr and colleagues at a highlight plenary session presented the multi-center study assessing the safety and efficacy of muscle-derived stem cells for women with urinary incontinence. And they considered it safe and with durable relief, but that was for incontinence. So it's happening, my dear. It's happening. And yet the nationalist, the Center for, no, who is it? The FDA has issued warnings about some of these stem cell companies that are setting up, and there has been a 60 Minutes documentary on it where they ordered stem cells and half of them were dead and all that sort of stuff. So you can't just go to a stem cell center and do it. You have to really find a doctor who's doing their due diligence and is researching it and is understanding it. Okay. Kathy, so your doctor first said that your eye issues were not from Elmiron, but he called you back the next day and said it is from the Elmiron. So what do? You get off the Elmiron. That's what the Emory eye doctors say should be done immediately, is you should get off of the Elmiron, so that they think it's a cumulative issue. And so titrating yourself off of the Elmiron, and maybe swapping in instead something like Cystoprotect. I don't know. I don't remember if you were the one who had issues with Cystoprotect, though. I apologize if you were. We do have a new supplement coming out called Bladder Builder. It's the one I've been talking about for the last 6 months. It is almost here. It'll probably be here in the next couple of weeks, hopefully by the end of the month. And that is going to be very, very exciting because it has some of the same ingredients. It's got the chondroitin. It's got the quercetin, but it also has some beneficial bacteria and a brand new ingredient called PEA, which has excellent research behind it in terms of reducing pain. And so we will be doing the product launch. I will be doing the product launch for Bladder Builder towards the end of the month. And that's very, very exciting because it will be the next generation supplement. So that's something that you can ponder. Rita says, what about nortriptyline? Nortriptyline is another alternative antidepressant, low-dose antidepressant. They're not giving it to you for depression. They're giving it to you to calm nerves down. It's an option, but it also has very similar side effects. Hello, Julie Beyer. You guys, we have a celebrity in the room. Julie Beyer, the first registered dietitian to ever work with IC and the IC diet. She's the author of several books on IC, Confident Choices, Customizing the IC Diet, Confident Choices, a cookbook for IC and overactive bladder. Those are both available in the IC Network shop. She is also an author and contributor to the IC Diet Project, which is a project that Julie, Bev, and I do. We do articles on the diet a couple of times a year. And it's at icdietproject.com. Go check it out. Lots of new recipes, lots of recipes over there, some old, some new. Sam just said she recently had a hysterectomy for endometriosis, adenomyosis, scar tissue, a fibroid, and cysts. During the surgery, they did a urethral dilation and bladder biopsy to make sure it is IC rather than something else. That's what they did for me too, hon. They went in and did well, they didn't just do a urethral dilation. They did a low-dose hydrodistension to make sure they hadn't put a suture through my bladder wall and to make sure it wasn't injured. Sherry has a doctor sending her out to do home catheterizations. Awesome. Hey, you know what, guys? I was working with a patient last week who was really, really afraid to do it. She was saying, I'm not doing it. I'm not putting anything in my bladder. And I said, girl, if there's one skill that would really come in handy, it's just learning how to catheterize. So if you're ever at a point where you can't empty your bladder, you can catheterize and empty your bladder. Granted, that doesn't happen that often. It's a very, very small subset of patients who would ever do home rescue installations. That would be IC subtype 1 or IC subtype 2. But that said, it's an awesome skill to have. Don't be afraid of it. Do it. Learn it. It's easy. Provided, of course, you've taken a mirror and you've looked at your body. Because a lot of you haven't. You don't even know where your urethra is down there. You gotta, come on, don't be afraid of your body. Look at it. It's a miracle. The human body is marvelous. Jennifer loves the Bella Rosa coffee. She says it's awesome. Awesome. Sam is wondering why these conditions seem to come together and why. You know what, hon? That's one of the things that we're still trying to. I mean, when you have in the lead story of our magazine, and in fact, I have it right here. It's at the printer right now. Our lead story is on fibroids. You know, so, and I have a great picture. Let me print it out and show it to you. Hold on. Let me, here, let's see, page 1, 2, 3. Let me print out page 1 and 5. Show it to you. One. All right. And 5. All right. So, you know, the challenge with pelvic pain is here you've got your pelvis, which literally is like this size. Put your hands together like that. That's the size of your pelvis. You've got your bowel, you've got your reproductive tract, you've got your bladder, and you've got muscles woven throughout and nerves woven throughout. And they are so close to each other. Whoops. Oh, well. All right. I won't print it out. My printer's being weird. Anyway, so they're so close to each other that they can easily impact each other. So we know that tight muscles can make it hard to have sex. We know that tight muscles can squeeze the urethra. We know that tight muscles can contribute to constipation. So what do fibroids do? Fibroids are interesting because fibroids are usually benign growths of tissue, and they can be either on the inside of the uterine wall, on the inside of the uterus, inside the uterine wall, or even outside of the uterus, connected by a little tube. So you can have this little, if you've ever seen Dr. Pimple Popper, like that TV show, which I love, it's just fascinating. People get these little growths that have to come out. They're just little benign masses of stuff. They don't mean anything, but they're kind of disfiguring externally. Well, when you have a growth on the inside, especially down there, especially in your pelvis, they're going to impact other things. So fibroids can easily push against the bladder and trigger the bladder and trigger symptoms of frequency urgency. And we had a research study that came out 2 months ago, which showed that, oh gosh, what was it? 67% of the women with fibroids who had urinary symptoms were cured of their urinary symptoms after the fibroids were removed or reduced in size. So it's just an accident of proximity with fibroids. What are the freebies I'm giving away? I'm giving away today, we're going to give away a Tyler's low acid K-cup, and we're going to give away a When It Hurts Down Here. But you have to stay till the end. So Christy says her daughter is showing icy symptoms. She's 11. I remember her symptoms at age 5. Her pediatrician says to send her to a urologist. I can't fathom that. Is there a pediatric urologist that specializes in IC that you have ever encountered? And the answer is yes, Christy. Dr. Robert Evans at Wake Forest University in North Carolina. I have a mother and a daughter who fly from California to North Carolina to see him, and they love him. Robert Evans, we wrote an article on children and IC, and Robert Evans helped us adapt the treatment protocol for a child's body and the diagnostic workup for a child's body. That's in one of our back issues of the IC Optimist. And so if there's anybody that I can give an absolutely glowing recommendation to, and I mean recommendation, it would be Dr. Robert Evans at Wake Forest University. Wake Forest Baptist Health. Just Google his name, Robert Evans, urology, and he'll come up. And he is the best that we've got in the country for children. I want to plant a couple of seeds, though, for you. For some people, remember, we've got these subtypes. We've got Hunner's lesions, bladder wall injury, pelvic floor injury, a nerve injury, and then the final subtype, which is central sensitization. And central sensitization is often the inherited subtype. So what does sensitization mean? Sensitization means that through well, for some of it, not for all of us, but for some of us, and I'm in this category, IC goes back 3 generations in my family. It is characterized by very sensitive skin. In fact, you can see I got this crazy rash right now. I'm doing phytotherapy. It's crazy. We have very sensitive skin. We tend to be drug sensitive, where normal doses of medication are too strong for us. We tend to be food sensitive. There are some foods that just don't work in our bodies, not just our bladder, but our body as a whole. Like I can't do chocolate, it just destroys me. Terrible cramping if I eat chocolate and oatmeal. The food everybody says to eat, no, I can't eat it. Leave it to me. We tend to have a wicked sense of smell. We can smell things that other people can't smell. And for me, this started in childhood, and my sister too. And I can still remember my mother not allowing us to use bubble bath. And when we did sneak it in, we ended up with symptoms because we reacted to the chemicals in the bubble bath. So if, you know, for us, that's not a disease process. That is the gift of our ancestry. We tend to be of Northern European descent. Hello, I am a redhead from Norway and Sweden. And if we go back in time, what we find is, my personal theory is that our ancestors, through evolutionary adaptation, needed sensitivity to survive, to find food and to smell good food and bad food. There was a reason why our nerves are more sensitive. I can't tell you what that reason is, but we tend to have this sensitivity going on. Not her fault, not your fault. Goes back thousands of years. So that's concept number one. I had my first symptoms in childhood. I had my first sore stomach when I was in elementary school, 4th grade. I had my first bladder symptoms in 7th grade that we all now correlate with central sensitization. But the other thing we want to look at too is pelvic injury. So if, for example, she was a big trike rider, riding her bike, if she fell a lot, you know, she could have a pelvic floor, some sort of pelvic floor trauma too. That would be it. So if you'd ever like to talk, please feel free to give me a phone call. I love to talk to you more. I love working with moms. I think the most important message that you need to hear and your daughter needs to hear is it's not your fault and it's not her fault in any way, shape, or form. Jennifer says she can barely tolerate 10 milligrams of amitriptyline. I couldn't. Dottie says that she too is an Elmeron pigmentary maculopathy patient, not as bad as the other patients, but your peripheral vision is poor and may get worse. She said that there was a silver lining to that dark cloud because a young tech in the office had IC and was not getting treatment, and she hooked her up with a doctor in the IC network and all that sort of stuff. So awesome. I hope everybody understands the Elmeron issue. If not, let me just show it to you because I pulled it out. So we know that Elmeron is the only FDA-approved medication for IC. However, let's see. So let me just give you the background on this. For those of you who don't know, this is so incredibly important and incredibly disappointing. Researchers at the Emory Eye Center last spring, a year ago, published a paper about 6 interstitial cystitis patients who had this rare retina damage that they call pigmentary maculopathy. It means the colors of the retina change. And this is the actual paper. Pigmentary maculopathy associated with chronic exposure to pentosan polysulfate. Pentosan polysulfate is Elmiron. And it's a really interesting story because they actually had a couple dozen IC patients sent to them for workup to try to figure out why their eye issues were so bad. And they ruled all the genetic stuff out, all the heredity stuff out, other injury stuff like that. And ultimately what it came down to is that they were all taking Elmiron. So they wrote this case series. It's not a case study of one patient. It's a case series of 6 patients. And they published it in the Journal of Ophthalmology. Now, of course, the urology community does not read the ophthalmology journal. We have no reason to. And it doesn't, and kind of in their search engine stuff, they didn't really refer to interstitial cystitis to make it as logically searchable. So it never came through our research feed. And then I finally found it. So they were trying to find a way to get the urology community to pay attention to this. And what they did is they wrote a letter to the editor, to the Journal of Urology, on another article. And they said, hey, we want to let you know that we believe that we have discovered a new rare disease that is associated with the use of Elmiron. And I found it the last week of August. I just sat here dumbfounded, and then I started crying because I knew thousands of patients were using it. And if you go back and you watch these live videos back then, you can hear me talking about it as it was happening. But let me show you. So they had 38 patients in their clinic at that time. They now have many, many more. So here's some pictures of what's happening. So they think what's happening is that a toxic byproduct of the Elmiron is building up on the retina or changing the retina. And so this is a time series. So look at this middle one. So we started with a small collection, and then over time it got bigger, and over time it got much bigger. And for these different tests, you can see that it gets worse over time. And this is even better. So again, small dot, bigger, bigger. And these are actually the cells of the retina changing. I mean, look at that. That's crazy. Of these 6 patients, they did an average age. They used it on average 15 years or whatever. These were tended to be older patients. However, one patient in the study, I think it was patient 4, who has been in these lectures, by the way, was actually quite young. She started the Elmiron at 24, and she had her first eye issues at 26. And she's now 38, and she actually had the worst damage of all of these patients. So as you can imagine, this set up a massive ripple effect in the IC world. And we immediately not only wrote an article about it, because you certainly need to know about it. And I am stunned that the other IC group is not talking about this, because what these doctors say is to prevent your eye disease from getting worse, you really do need to stop the Elmiron, and that's what they recommend. We did our own research study, our own survey with the help of Rob Moldwin. The last time I looked, I think it was 900 patients had participated so far, and we had a 53% rate of eye issues with Elmiron users in our own study. We presented that data to the to the FDA, asking for a citizen's petition to get the label rewritten, a warning issued, so that patients taking Elmiron should have their eyes tested once a year. It's not everyone, but it's quite a few, and we're getting new calls every week now. So there are some doctors out there who are saying that this is just a case series, it's not meaningful. I can tell you right now that Emory has expanded their research dramatically. We are referring doctors to them all the time. They're now doing a multi-center study across the country. And this is not a little thing. This is a big thing. I think it's stunning what's happened. Luckily, if you can't take Elmeron, we do have some supplements that do have a bladder coating effect, like Cystoprotec, Cystorenew, and Desert Harvest Aloe. Okay. Also, you know what? I forgot to thank our sponsor. We have a sponsor for these meetings, and that is Preleaf. Preleaf reduces acid in food. And so Preleaf has agreed to sponsor our life support group meetings this year. So in return for me saying, hey, have you ever considered trying Preleaf? It reduces acid and it reduces acid. Calcium glycerophosphate has been the top supplement in the IC world for 25 years and counting. If you're going to eat a risk food, you can take a Preleaf beforehand, and it might make it more tolerable for your bladder, like if you want to have that glass of wine or you want to have a little bit of coffee. That said, you should not take Preleaf like candy. You take it before you're going to eat something. Some patients just do more. Please don't do that. It is, I come from a less is more standpoint for all the stuff that I personally use. So thank you, DSC Healthcare Solutions and makers of Preleaf, for sponsoring this meeting. Very much appreciated. Jennifer says, you're having surgery next month. Worried about your bladder. Any suggestions? As long as it's not bladder surgery. What kind of surgery are you having, hon? Debbie, going to her second physical therapy appointment. Awesome. Awesome. Good luck. Just remember, the most important part of physical therapy isn't the appointment. It's what you do when you get home. You got to do your exercises at home, which I have not done for a couple of days because I can be passive aggressive. Alyssa says, have you ever heard of very low vitamin D over a long period of time? I cannot get it up and get it to absorb. I have C and celiacs. I know, not specifically related to IC. I do know that Desert Harvest Aloe has a vitamin D aloe you might want to try. I don't have any experience with that, hun. I know that quite a few women do have low vitamin D levels, and I don't know if it might be chronic patients, both men and women. I'm not sure. I'd have to read up on that. I take vitamin D though almost every night. Hi, Aaron. Thank you, Eric. Wendy said that she had a silver nitrate treatment back in the day, and that is the reason your IC is so intense. Yeah, silver nitrate, we just don't do it anymore. It's not even suggested in the treatment guidelines. It is a bladder stripper. See, I'm squirming. I'm squirming. Okay, hold on. Let's see if I can make myself more comfortable. Now, see, and I'm not supposed to sit on my foot, darn it. Hold on. I got to get comfortable. Hold on. Okay, I'm going to sit on my foot anyway. I might have to go get my yoga ball to sit on. Alrighty. Nope. God, darn it. See, you're witnessing firsthand left side pelvic floor dysfunction. Oh, you push in on a muscle and it's like hurts. Oh, there it is right there. Left glute. All right. Eric says, your question is, bowel activity can flare some symptoms that make your penis uncomfortable and can make you feel like you need to urinate. Yeah, hun, that's absolutely true. And I'm even weirder than that, because what happens for me sometimes is my feet tingle about 10 minutes before I need to have a bowel movement. So I know if my feet start tingling, I need to stay close to a bathroom. And it's usually 10 to 15 minutes later. And I correlate that with the just proximity of the nerve. The nerve is obviously right next to the bowel. And when you've got something of a certain shape going through, it's going to push on that nerve and cause that sensation. We also know that constipation, when you get more stuff in there, it tends to be a bit more uncomfortable. It's important to up your fiber intake. Make sure you're eating, for men, I think it's 35 grams of fiber a day to be normal. We have an article on that in our magazine that's at the printer right now. So I think that the reason why you feel a need to urinate is because you're probably very full and it's probably pushing on a nerve. It's hard to say. I really look at it as a proximity issue. And also for me, I remember that your stool is supposed to look like, after you pooped it out, a long soft tube like a snake that softly curls. And when it's soft like that, it doesn't push anything. But if you're prone to having hard stools like I am, which means we're not eating enough fiber or not eating enough water, running with dehydration, then you get a harder mass, which is going to push into those nerves. So I think that getting onto a high fiber diet, let me see, I got my magazine right here. Hold on a second. I can tell you what they recommend. 38 grams of fiber a day, 25 grams of fiber a day for women to have normal bowel movements. And I will double dog dare you to count up your fiber. As an example, if you're eating salads because you think salads are high in fiber, you couldn't be more wrong. One serving of lettuce is 1 gram of fiber. One serving of green peas is 13 to 16 grams of fiber. So when I went to a gastroenterologist because I was struggling with a lot of rectal pain and all this going on, this is like 12 years ago, 14 years ago, my hemorrhoids were killing me. She said, how many grams of fiber do you eat a day? And I was like, I don't know. Nobody's ever asked me that question. And I said, I'm sure it's good. And she goes, I double dog dare you to go count it up. She said, you need to eat at least 20 to be normal. I went home, counted up my bread. Yeah, I was eating 6 grams of fiber a day. No wonder I was constipated and things were hard and painful. And when I used their fiber list and I actually went up to 20 a day, holy moly, things got so much better. So much better. So that's what I would do, is I would be working on that fiber intake. Hey, Sam, with your daughter, make sure you're not giving her a lot of juice. You know, the little foil packets of juice or OJ. It might also be very interesting to do a next generation urine test with her, just to make sure that there's not some sort of legacy of that initial infection that she had in childhood. Next generation urine testing is called, basically, it's so much better than a typical urine culture. Next generation urine testing. Go to the website bladderhealth.org. and watch the videos of the doctors that use it. It's only $199. You send your urine in through the mail. It will identify good bacteria, bad bacteria, and fungus, because for all we know, she could even maybe have a yeast infection in her urinary tract. That's a possibility that typical urine testing would not reveal. Right? And so if she had a UTI when she was young and she was treated with antibiotics, and if you give her a lot of juice, then it may be that you've got a chronic fungal infection going on in your bladder. And that next generation test would absolutely identify that for you, where a typical urine test would not. Hello, Corrine from Belgium. Does amitriptyline cause forgetfulness and cognitive? Yes, absolutely. There are warnings about it. There are absolute warnings about it. If you're having any cognitive decline and you're taking amitriptyline, you need to tell your doctor, you need to do another medicine. Patricia said the doctor she just saw last week wanted to prescribe Elmiron. Yeah, not anymore. Elmiron has a place. It is a step 2 treatment option, but we want to make sure that, remember, we have 6 steps of treatment. They're arranged with respect to the risk of adverse event. You start at step 1, do everything in step 1 before you go to step 2. Do everything in step 2 before you go to step 3. Elmiron right now is sitting in step 2, but I have a feeling that it should be moved to maybe step 4 because of the eye damage. I'll have to email the chairman of the committee and see what he thinks of that. Hello from Utah, Shauna. Hi, Shauna. Shauna says, does anyone else run fevers from a flare? Boy, I used to, but you know what? I think they were little mini hot flashes. I think they were hormone driven. So is it a super low grade fever, like 99 degrees, or is it 101 or 102? I mean, if you're over 100, then there's something else going on that your body's fighting. But if it's just a very, very, very low grade, that's an excellent question, my dear. And does it happen every time? That's the other thing that I think would be very interesting. Alyssa, if you only knew the money I've spent in the last 15 years buying desk chairs to work at, I probably spent $5,000 just trying to find one I could sit in. But ultimately, what really helped me, let me show you the 2 things that help. Where is it? We have a bladder and prostate friendly chair cushion that has a groove down the middle. So each butt cheek is supported, but absolutely nothing is touching your crotch. And that might make it easier. This is good for men who need to dangle or women who have urethral or vulvar or rectal pain. However, I may have to discontinue these. The California no longer allows any foam products that contain fire retardants. And I've asked Dynatronics in the last 3 months twice to verify that the foam in this contains no fire retardants, because they started putting a proposition, a hazardous label on it. We asked them why, and they, let's just say that I am being incredibly assertive in wanting to get an answer to that question, because I don't want to sell anything with fire retardants in it. And I just got an email from them again on Friday. They're trying to pass the buck, and they're just saying, well, we're just going to put a label on it so people are warned. And I'm like, it's illegal for me to sell it in California if it has fire retardants in it. The label does not help me. I cannot sell it, period, if it has fire retardants in it. You need to get an answer to that question. And they custom make these for us. So if you want a chair cushion, get it now, because we're not placing a reorder. But again, the whole fire retardant thing is deeply concerning to me. We know fire retardants and foam cause cancer. Well known. That's why they're banned in California now. So I'm trying to get an answer for you. The other cushion that we have is a waffle cushion. It's an air cushion with no foam in it, and that's perfectly fine. And I sit on the waffle cushion more than this cushion. This is the bad hemorrhoid cushion, or the vulvodynia cushion. But for the left side pain, it's the waffle cushion is the one that I sit on. We are also having spring allergies. So if I'm doing my nose, it's just because I've been sneezing like mad. Kim, now Kim, that's very interesting. Kim said she had terrible floaties in her eyes, not the good type. And the doctor said it looked like it was medicine-induced cataracts. Your eyes have been great since you stopped the 3-a-day dosage. Awesome. You know, Kim, I think it's very important that you let your doctor know about the Emory study, because they want any eye doctors across the country who are working with Elmeron patients to participate in their research. Shauna says you can't do, that's okay if you can't do Elmeron, because Elmeron is linked to eye disease now. But what you can do are the supplements like the Cysto Protect, the Cysto Renew, or the Desert Harvest Aloe. They have a very similar effect without the long-term risk that we're aware of. You know, let me get back to the Elmeron for a moment. You know, this is just one really, really important point in this paper. So, you know, I mean, the Emory Eye Center, they specialize in rare diseases, and believe me, they did their due diligence. They really tried to figure out why interstitial cystitis patients were having retinal problems. And they found a study that I had never seen, and it was a 3-month placebo-controlled study of 258 patients before the FDA approval of Elmeron. Let's see, hold on. Okay, there were 2 studies before FDA approval. A 3-month study found no vision problems. However, an unmasked clinical trial of 2,500 patients who took the drug for up to 4 years had eye problems. They had optic neuritis, amblyopia, and retinal hemorrhage. And so, you know, nobody in the IC world has ever talked about eye issues with Elmeron, to my knowledge, except for the last 6 months. I never saw this early study. This early study proves that the company knew that there were vision damages before FDA approval. And I think those were greatly underestimated, and they should have been tracked. It's stunning to me. I mean, they say it's premature to conclude a definite relationship. However, it's looking pretty clear that that's what it is. All right. He calls me his own. Hey, Jill, what are good home exercises for pelvic floor while in chronic IC pain? Thank you. Well, the one of the most important ones I will demonstrate. Not that you need to look at my butt. Okay, I'm zipped up, right? Okay, good. Is to just squat down. Oh, except there's my knee. I hurt my knee. I'm going to predict that in the next 6 months, I'm going to lose a ligament. I hope not, but I might. Okay, so if you just squat down like this, you're putting your pelvic floor in exactly the right position. Now, if you squat down like this and it hurts, that points to your pelvic floor. Get up. But what that does, is that it puts your muscles exactly where they're supposed to be. Hold on. I know better. I should always take these books out before I even start these meetings. Okay. One person here, when I first started doing the support group meetings, she did that and it actually hurt her and she kept doing it. And so it's like, guys, seriously, if something hurts, please stop. Don't do it to the point that it hurts. You know, don't keep doing it. It's a symptom. It's a sign. It's a clue. It's a clue. So you need to invest in one of 3 books. Okay. The Interstitial Cystitis Solution by Nicole Kosian, which is the first book to really explain the bladder muscle connection really well. Or Ending Female Pelvic Pain by Isa Herrera, which is, in my opinion, just the Bible for things that you can do at home. You can see I've got a whole bunch of Post-its in it. And here is a demonstration of the prayer squat, which is what I just showed you. It's a good way to get those pelvic floor in a good situation, provided you have a good knee instead of a partially torn ligament like I do in my left knee. Or if you're a man, you can get Ending Male Pelvic Pain, which is a phenomenal book. And all the pictures in it are with men, pretty much. Oops. See? Or you can get Heal Pelvic Pain by Amy Stein, which is written for both men and women. All right. So what you don't do is you don't do Kegels. If you're doing Kegels, you're just making it worse, because Kegels are appropriate for people who are incontinent because their muscles are weak. But for us, that's not our problem. Our problem is our muscles are tight. So the last thing we want to do is tighten tight muscles. That just reinforces the tension. Oh, awesome. Alyssa is seeing Dr. Robert Eckenberg. She travels 6 hours to see him. Robert Eckenberg is in Bethlehem, Pennsylvania. He's probably the top pelvic pain doctor in the nation. He's absolutely fabulous. Ellen, is Epsom salts okay to use in a hot bath? Yeah. Aveeno, though, is better. The Aveeno bath soaks. I don't use Epsom salts. I use baking soda when I take baths. And I don't take them that often. I should take more. You know, salt on a wound kind of hurt a little bit. But, you know, I like the baking soda better myself. We also have, oh, you know what? I don't even know. I don't know if, hold on a sec. Hold on. We had these fabulous bath bags that were filled with herbs. I don't know if we still have them or not. Where would they be? Trying to remember, what were they called? Hello, I got menopause here. My brain is not a 30-year-old brain. Well, I don't see it. We might have discontinued it. We had these really good bags of, they were organic muslin bags filled with herbs that were created for people with vulvar vestibulitis. Work really well for calming and soothing. Also really well for women with episiotomies. So you can check our store. And I don't remember. I don't see it. We might have discontinued it, but I can get the name for it. I just don't remember what it is off the top of my head. Look at this. We've been going for 2 hours. Penny says she was recently diagnosed with Hashimoto's. Her doctor put her on an autoimmune protocol diet, and your IC symptoms have greatly improved and quickly. Penny, I would love for you to share your story in our magazine. Would you be willing to write up what you're doing and how you've changed your diet so that we can share that with other people? I'm assuming that you've gotten rid of sugar, white flour, and pretty much dairy, right? That's the common foods that are associated with inflammation. But I'd love to hear more about the foods that you've, how you've changed your diet in that way. I mean, I do think that plays an important role. I think our diets are absolutely terrible, and they're so affected by chemicals, and we're so addicted to sugars. Even myself, oh my God, the after dinner carb crave is almost uncontrollable. I have to have something. I started doing celery and almond butter, but I couldn't do it at night because it was giving me gas overnight, but do that during the day. But finding that sweet thing is hard. We're all addicted to sugar at this point in time, and sugar causes a lot of inflammation. Sister Aaron's asking about Sister Protect and bowel issues. Yes, for some people, Sister Protect can trigger loose bowel. I was one of them. I can take 1 a day and I'm fine. Take 2 a day and I'm not fine. It gives me loose bowel. So remember, a more is better is not appropriate for a lot of us. Sometimes it's about finding the lowest effective dose. So if 1 works, then do with 1. Don't go up to 2 where it gives you issues. You've got to find that right balance for you. Susan asks, are split peas, lentils, and flax seeds well tolerated? Split peas are well tolerated. Flax seeds are well tolerated. Lentils can be a little bit on the acidic side. And black beans too. I once had a terrible flare from black bean soup. So I think you can dive into the split pea soup, no problem. Flaxseed shouldn't be an issue. With the lentils, I would try a small amount and see how you do. Same with black beans. I don't eat black beans, but I refried beans like a beast. Wendy is asking, does damage go away when you stop taking it? With the retinal damage, no, but you stop from making it worse, they think. You know, because the cell changes color. So we don't have enough research to know if it ever goes back. The assumption right now is that it's probably permanent. I love the way you guys are supporting each other. Good job. What's my opinion of a low-dose naltrexone for IC pain? Give it a shot. I don't have any personal experience with it at all. Dottie says, are we talking class action lawsuit against the marketers of Elmaron? You know, I think so. I think so. I mean, we need more data first. There's not enough data right now to make that happen. But I think that that's coming. I do think a class action lawsuit is probably coming. The question is, what would be meaningful about doing a lawsuit is being able to do discovery to find out what they knew about the eye damage before it received FDA approval, how it was presented to the FDA, if it was presented to the FDA, if it was minimized, whatever. I will tell you that I don't believe that there was any malintent on the part of anyone. The guy who invented Elmiron and the company who did their work are stellar people who really care about IC. And as the researchers from Emory say, this potentially could be something that no one could have foreseen, 20 years after the fact. However, the fact that they found those early research studies showing eye issues kind of defeats that argument. So I know of a couple of patients who have talked to attorneys, but it's a little early yet because we need more data. Janssen Pharmaceutica, who currently owns Elmiron, is not involved in the IC movement. They have not been for a decade. Very distant, not supportive in any way. They haven't done anything that I'm aware of in years and years on behalf of IC. To them, I think it's just, they're waiting for the generic. And so they raise the price until the generic comes out. And I think it's just sitting on the shelf as a money-making that they really have no interest in pursuing anymore. I don't think that they're investing any time in it anymore. And the gentleman who invented it, I don't believe has made any public statement about it. At least I'm not aware of it. I know he would be furious with me for talking about it, but I feel that we must all talk about this, because as one person said to me, when we first did the article, she called me and said, "Oh my God, you just prevented me from going blind." And I went, "Why?" And she goes, "Because we didn't know why my eyes were getting so bad. But with this data from Emory, now we know." And they were able to stop the Elmiron and save her eyesight. So I think it's going to happen at some point in time. Aaron, how do you get people to understand IC? Well, you got to have realistic expectations. Even doctors, man, if you've never had bladder pain, you don't know what it feels like. You can't expect them to be able to say the right thing to you because they don't know what it's like. They don't know what it's like to go out on a date, have a glass of wine. 30 minutes later, you're peeing every 5 minutes, crying, and you need to go home, and you lose that date and you lose that guy. That happened to me, So the AUA guidelines, if you have them printed out, are perfect for medical care providers. And then for your friends and family, you show them my videos. You can show them the website. I tend to explain IC as an injury or trauma to the pelvis. I don't talk about it as a disease as much because we don't really believe that there's a major disease process happening, except in Hunner's lesions or for chronic infections. But for many of us, it's a physical trauma, a bladder trauma from chemical exposure or from muscles. And so when you explain it that way, and it's like, yeah, you can't see it, but it's there. And this is what it does to me. It has affected my urinary function, and I have to pee a lot when it hurts. I'm also completely in support of doing little white lies if necessary to make the point. I know I was on a plane flying from Orlando to San Francisco, and I needed to pee so badly, and the seatbelt sign was on, and it hurts. That's the thing, is when you have an injured bladder or sensitive bladder, we're not talking normal urgency. You're talking, oh my God, I'm going to burst out crying. I'm dying in pain. Please let me pee. And this young, arrogant flight attendant was like, "Ma'am, sit down. You may not pee." And it's like, I was crying at that point in time. I have to go. And she's like, "You look fine. Sit down." And I was like, and I lied. I said, "Listen, I'm going through chemo. It's killing my bladder." And she's like, "Oh, okay, go ahead." Was that a lie? Yeah, that was an absolute lie. Did it get me access to the restroom? Yes. And I think it was justified in that circumstance, but I certainly wouldn't lie every day, and I wouldn't lie to family and friends. You got to be truthful. Truthfulness is important. She was just not interested in learning about IC, so I went for the big gun. Aaron, some of the people closest to you have been the worst. You know, I would say that that was true for me early on when I was in my 20s and going through a lot of stuff, going through the IBS and the vulvodynia and all the other stuff and the migraines. I didn't have a lot of sympathy for my siblings at all, but now they're really good supporters for mine. I think it just takes time. People need to learn. People need to, you know, I think they see that as you get older, you know, you're not seeking attention. You're suffering. You're suffering, and they come to see that and they come to respect that. But yeah, there were things said early on that were very, very painful, but they didn't know. I didn't know how to explain it, and I'm not going to blame them for it now. It's over and done. The past is over. Not going to agonize over it. Today is a new day. I love my sibs, and I'm going to support them however I can, and I know that they will try to support me as much as they can. Gwen, if you send me an email, I'll try to, or you know what you could do, Gwen, is if you can go over to our store, go onto the IC Network website, click on shop. It'll take you over to the shop website. Send an email to customer service, and they will and say, do you still carry the bags, the bath bags for vulvodynia? And ask for the brand name, and they'll tell you the brand name. She gets to work at 7, so you could have an answer very, very quickly tomorrow. Guys, I want you to remember that IC Awareness Month is in September, and I hope you will all participate. That's when we all work together as a group and kick some butt and educate people in our communities and our families about IC. We have a poster contest. We have press releases you can share. They're not done yet for 2019, but just know that there is an IC Awareness website. I am the chairman of the IC Awareness campaign, icawareness.org. We've been doing it for several years now, and it's all about you. It's not about me. We just does not promote the IC Network. It does not promote the ICA. It does not promote Jill Osborne. It's about you kicking butt in your community with some really good resources. Okay, hey guys, give me 1 sec. I gotta go make sure that my folks are okay. They're 96 and 90-year-old. So give me a minute. I just want to go run in. I haven't heard them in a while, so I gotta go check on them. All righty then. They are well. My father, Jack Osborne, is down in his radio room. He's a ham radio operator, 96-year-old, going up and down the stairs. Yeah. My mother is watching TV. Helen Osborne, my traveling partner for the IC network until her hip replacement went bad. And it's time for some sparkling water. Don't do soda. I've only done one soda in 5 years, a little thing of 7-Up because I was nauseous. This is LaCroix sparkling water. All right. Penny said her diet is no dairy, gluten, grains, soy, sugar, nuts, legumes, eggs, nothing processed. Woo! Penny, if you can just outline what you're doing, I will rewrite it for you. But this is important, guys. You know, another big story in our magazine is an article that appeared on another website about 10 different causes of quote unquote bladder symptoms or IC, and how patients healed and responded. And so, you know, as an example, one was candida, yeast, one was pelvic floor dysfunction, one was Lyme disease, one was chronic infection, and yet another one was gut dysbiosis, where their biome, their beneficial bacteria, had been so badly damaged by the antibiotics they'd taken that they had to basically rebuild it, just like what Penny is doing here. So, and that's hard. You know, I try so hard to keep my sugar down, but I mean, I might have 2 teaspoons a day and I still shouldn't be doing that. But going off of sugar and grains, oh, holy moly. So I'd love to hear what you're eating. You know, what's a typical breakfast for you? What's a typical lunch for you and a dinner for you? You noticed improvement 8 days, pretty amazing. Lots of info online. And I've done the paleo diet too. Yeah. Diane is asking, have I heard of Balani, Dr. Balani in New York? Is that Sonia Balani by chance? I might have heard that name. Sherry, what is the issue with the eye issue with Elmiron? The eye researchers have now believe that Elmiron, a toxic metabolite of Elmiron, gets deposited on the retina and causes eye damage. So these patients have fuzzy vision, difficulty reading, a lot of difficulty in low light. You know how if you walk in, say you're walking into a dark movie theater, that you got that period where your eyes adjust, and it's fairly rapid. But in these patients, eyes don't adjust, or it's very, very long to adjust. You can find articles on our website about it. It's a big deal. Dozens and dozens of patients now have been diagnosed with this eye issue by eye doctors across the country. I was last working 2 weeks ago with an ophthalmologist in San Diego, who was seeing it in his Elmiron patients. And Elmiron, it was invented in San Diego, so that's where we would expect to see the most. So I believe he is participating in the national research study now. In our own research study, we had, in fact, I can look. Let me look and see what I've going on with the IC Network survey on Elmiron and eye issues. Let's see. Going to my survey results right now. So here it is. We have 926 responses to our survey. And let's see. 95% are women. 783 of them have taken Elmiron, brand name or generic, anywhere from less than 1 year to more than 20 years. And we have 53% report eye and retinal illness, which is a staggering number. Granted, for some, it could be genetics. The eye symptoms are difficulty reading, difficulty with low lights, blurry vision, dimming vision, blank areas of vision. And there were some others. I know retinal hemorrhage has been talked about a couple of times. There are 260 other symptoms. And that it's 79% of them sought the help of an eye doctor to get to the bottom of their eye issues. So it was so severe that they sought care. And it mimics macular degeneration. So some patients have been diagnosed with macular degeneration when it's actually this maculopathy. And in terms of time, we asked patients, how many years after you started Elmiron did your eye problems begin? 9% less than 1 year, 12% 1 to 2 years, 2 to 4 years, 18%, 4 to 6 years, 12%. And it just goes on. So 2 to 4 years looks to be the magic number in terms of our survey of people saying that's when they started to notice eye issues. So come on over to our website and read about it. It's in our blogs. Dottie retired from Janssen. I'd love to hear about the culture of that company. Kim is asking, have you heard of Professor Malone Lee? Yes, we follow each other on Facebook, on Twitter. Dr. Lee is a very outspoken doctor who believes that all of IC is due to chronic infection. He just joined Twitter. He is a rebel. He is very vehement in believing that patients with IC should be treated with long-term antibiotics. And I have not had an opportunity to reply to him and show him the MAP research network that shows that actually, rather than bacterial infection, we're seeing fungal infection in many IC patients with flares, and that long-term antibiotic use would only make that worse. So, you know, he has his opinion and perspective, and that I completely understand it and support it, but it does not explain the fungal infection. And I'm waiting for another article in which talks about fungus in the urinary tract, and how they were saying that there's actually more diverse fungus in the human body than there is bacteria. So I'm waiting for that article. So who knows? Fungal infection may be something that we will all be looking at much more aggressively in like 5 years. Erin, you just had somebody tell you use it as an excuse. Gosh, what would I say to somebody say that? I don't know. What would I say if somebody said that to me? I would say, damn right, I'm using it as an excuse if I need to use restroom access because it's real. I need to pay now. Get out of my way. I don't swear at my family, though, so that's just between you and me. I try not to swear at people, except for one individual person who's in Washington, D.C. Then I swear frequently. Papilledemia. I don't know what that is. Sue, I'm so sorry. Sue was saying that her family made her the butt of a joke at a restaurant because they said that she never ordered stuff off the menu, and that she would probably send the food back. And that, you know what, Sue, that's when you just don't go out with them. I just wouldn't go out with them, you know, out for a meal. If you want to go out to a play, movie, if you can sit through it, fine, but pass on the food. And be really clear and say, you know what, that's hurtful. It's not funny. I'm in pain. I need your support. I don't need your criticism. And I really don't appreciate being the butt of anybody's joke. Sometimes you just gotta, you know, let them have it in a nice way. And, you know, just say, it hurts me when you do that. And sometimes, you know, I know for me, when my IC was really the worst, I always drove myself if I could, so that I could leave whenever I wanted to leave. And I would just leave and just say, I'm sorry, I just can't stay, and just walk out. I don't feel well. I'm leaving. Sherry's asked, does anyone get pain all the way around the middle of their abdomen, around their rib area, and through the back? That would be very unusual. That wouldn't really be, that would not come from your bladder. That would come from your pelvic floor. It tells me your muscles are messed up, probably. You know what, Kim, he says he's having great results with IC, but we got to see more published studies specifically with IC. Yes. There are more studies coming out, and I don't disagree with them at all, but you cannot make a blanket statement that every IC patient has infection. We have subtypes now, and our biggest subtype is not bladder injury, it is muscle injury. And so we don't want to get into the habit of telling everyone they need to be on long-term antibiotics, because that would be incredibly risky and unnecessarily for somebody with muscle issues. So that's what Dr. Malone Lee is not familiar with. He's not familiar with the subtyping. He's not familiar with the fungal studies. And I was just thinking about this last week as he was posting more. I really need to communicate with him about that and introduce that information to him, because I fear that he's actually making some patients worse. Some patients might be better. Some patients might be worse. Eileen says her diet has to change. Sure, that would make sense. Your biggest struggle is what to have for lunch. You know, yeah, I often don't eat lunch. I'll just go for pea chips or potato chips and guacamole, which I did yesterday, or organic tortilla chips and guacamole, toast with avocado on it, celery with almond butter, an apple. So Kim, you had the test done. You have an embedded infection and fungi in your bladder. You're taking antibiotics, but what about the fungus? What are you doing about the fungus, hon? Because the antibiotics are just going to make the fungus worse, because it's going to kill the good bacteria that normally keep the fungus in check. That's a missing piece here. So are you taking diflucan at the same time? And is this safe to do for a long period of time? Gwen, have you heard of Dr. Roscoe Nelson in Arizona? Not off the top of my head. Turmeric is IC friendly, but try it and see how you do. Yeah, Cindy, yeah. Eileen, I can't imagine who that person is. Oh, he has a name in my home. You saw a new local urologist, Ravonda says, who suggested either low-dose macrobid or Hyprex, which turns into formaldehyde in the urine, either indefinitely to prevent UTI or from UTI infections. He did not know about the microgen test, declined antibiotics, said macrobid is metabolized in the body by well and doesn't bother good flora. Flora, thanks for the info. Well, I think that's a little naive to say that microbid doesn't bother good flora. I don't know if that's true or not. I don't remember seeing any research about that. What type of bacteria? Macrobid is used to treat E. coli, Staph aureus, Streptococcus, and Aerobacter aerogenes. I have to do some research on that. That's interesting. I don't remember ever hearing a doctor say that macrobid would be safe for the biome. I don't know it. I don't know if it is. Damage. Let me try one other thing. Antibiotics can change the gut microbiome for up to a year. Oh, I remember this study. Yeah, it was a couple years ago. I wrote about that. All right, let's keep going. Hi, Jennifer. Let me go down to YouTube here. Anybody have corned beef cooking right now in their kitchen? I do. I can smell it. It smells good. Corned beef and potatoes and cabbage. I will eat the corned beef and I will eat the potatoes. I will not eat the cabbage because I do not want to fart all night long, which I will do if I eat cabbage. No shame. I'll tell you anything. Have I heard of Dr. Krieger at University of Iowa? Absolutely. Carl Krieger. Yeah, he's a big IC researcher. I don't know what research project you're referring to. He's been involved in a lot of them. What's the actual study? Aaron, if you have a deep infection, what then? Will the long-term antibiotics get rid of it? You know, you have to understand that you have right now 6 to 7 pounds of beneficial bacteria in your gut. Bacteria are important. Bacteria do things that keep us alive. As an example, one species of bacteria in your bowel produce the only food that the cells lining your bowel will eat. The human body doesn't. Now, we all thought that the bladder was a sterile organ, but now that we have next generation urine testing, we know that there is a robust population of good bacteria, 70 species of bacteria so far identified in the bladder. The challenge is that we don't know what they do and how important some of them are. I have no doubt that a couple of them are producing the food that are nourishing these cells. And when you take long-term antibiotics, it is a flamethrower. It's like burning a forest down. You burn the trees, you burn the bushes, you burn the flowers, you burn the habitat, the butterflies are gone, the larvae are gone. The only thing that survives are the earthworms, anything underground. When we need the forest to live. And so that's where Dr. Malone Lee is so controversial, is we have no knowledge of what that is doing to all of us over time. I mean, my generation, I was born in 1960. My generation is the first full antibiotic generation. My mom was born in 1929. Antibiotics were, I think, invented, in the 30s or 40s, around the time that she was born. So my bacteria, when I was born, was already manipulated by her antibiotic use. So when researchers try to find what a normal biome is, they have to go to Africa, to small isolated tribes who have not been exposed to fast food, modern society, or manufactured foods. So we don't know what the long-term implications are for antibiotic use and how it damages the physiological ecosystem. But here's what we do know. When you take antibiotics for a long period of time, you are extremely prone to fungal infection. I'm being treated for a yeast infection right now, my first one in a decade, because beneficial bacteria normally control fungus. They eat the fungus. We also know that when you kill the good bacteria, some of the pathogenic bacteria develop active infection. Think of C. diff. C. diff. That's when it can happen 6 months to a year after you've taken antibiotics. It's Clostridium, where all of a sudden you're peeing bloody diarrhea. And that's because you now have an opportunistic bacterial infection. So, and we know also, in food production, the vast majority of antibiotics manufactured in the world go to cows and pigs and chickens. And we know that in that environment, drug resistance grows dramatically. So remember, we had the Costco chicken debacle with Foster Farms, where the chickens weren't cooked and all these patients got, and people died, really severe infections that they actually labeled with the name, either the name Foster Farms or the factory where it was produced, because of the massive overuse of antibiotics. So I cannot embrace and support Dr. Malone Lee's wide recommendation that patients use long-term antibiotics. Instead, I think what we need to do is focus on the biome. I wrote an editorial about this earlier this year. We're going to start treating bacterial infection with good bacteria. We need to introduce the bacteria which kill the bad bacteria rather than using an antibiotic. And then we're also going to start seeing, what do you call it? Bacteriophage treatment, where they are able to introduce a virus to kill that bacteria. So I think it's really dangerous to make recommendations and statements that every IC patient has infection and every IC patient should take long-term antibiotics. What it means is if we have a chronic infection, our biome is messed up. So our question number one is, how can we restore that biome? And that's why the new supplement Bladder Builder is introducing 4 important species of beneficial bacteria back into the bladder. And we have the research from the MAP Research Network, which shows that IC patients are deficient in important bacteria, and we have too much of some bad bacteria. So I think in the end, 5 or 10 years from now, I think we're going to be looking at a lot of biome work and a lot of probiotics. And I've already been contacted by 2 companies who asked me to help them reformulate their existing products to include some of this new work. And I said no, because I'm working with Bladder Builder, but everybody's moving in that direction. Well, I also say no if you know, I'm not giving away my knowledge for free either. That's for sure. To a pharmaceutical company. Like, seriously. You got billions of dollars. You don't want to pay me $100 to talk to me for an hour? No, I'm not going to talk to you. Ooh, Erin. So she loves cucumbers rolled in all natural turkey breast. Now that sounds awesome to me. And you could do ham too, an uncured ham, uncured turkey. That sounds great. Susie said, her IC came back days after steroid shots to the lower back for sciatica. So Susie, again, what I would be asking is, is this a bladder wall flare or pelvic floor flare? I can see a scenario where either or could be irritated. I mean, if you had steroid shots in your lower back, that tells me that your lower back is very tight. Maybe the steroid shots were painful. Maybe your pelvic floor has gone into spasm. Or could there have been something in the shot which was metabolized through your kidneys, ended up in your urine that irritated your bladder wall? Gwen, you're saying the lime in chips messes you up? Hun, you got to understand something. The lime in chips is not citrus lime. The lime that you find in potato chips and tortilla chips is not citrus. It is a mineral that does not irritate the bladder. So it's like chalk. It wouldn't irritate the bladder. But some people have been irritated by avocado. Not too many, but some. Susie, are doctors still prescribing LDN for IC? I think so, to a small extent. It's not real popular. Gwen, is Marketing bad if microbit is? Sure, any antibiotic has the potential of killing beneficial bacteria. That's the whole point. Susie says, took me 5 years to heal 95%. It was the nettle leaf tea that really helped me. I totally believe that. I totally believe that. Nettle leaf tea comes up frequently. Stinging nettle leaf tea. Slippery elm, yep. Chamomile, yep. Honey, yep. Sue, is corned beef okay to eat for IC? You know, it's not perfect, but I think once a year it's fine. Just, you know, do your pre-leaf, drink some water. Hun, Eileen asks, how can I eat corned beef and not have an attack? Because my subtype is different. I don't have bladder wall damage. I have a perfectly normal bladder. What I have is pelvic floor, so I'm not as food sensitive. So yeah, I could even have coffee if I want. If I start drinking a lot of coffee, I shake like a leaf. And eventually it'll get to me because I am menopausal and I don't have a lot of mucus in my bladder, but I have a healthy bladder. So I can get away with stuff every now and then. So I'm IC subtype 3, subtype 5. If you're IC subtype 1 or subtype 2, then corned beef might be a little hard for you. Why do they want you to take an antibiotic after a cystoscopy? Because anytime you put an instrument into the urethra, you're introducing bacteria potentially. And I talked about that earlier. We call that a hospital-acquired or a nosocomial infection. Those infections tend to be the worst of the worst because they're the ones who tend to be the most resistant. And so it is usually important to take a single antibiotic either before the cysto or after the cysto. Alyssa says, can you please tell me the name of the supplement? It's called Bladder Builder, and it will be available on the IC Network website, hopefully by the end of the month. I just sent them my first check for inventory. So it's new, it's different. I haven't even taken it yet myself, but it's being supported by the top IC research doctor in the country, patients are already trying it in their clinics, and it's looking very, very promising. Kim, what do I need to do for an embedded infection then? If you're going to do antibiotics, you should be taking a probiotic at the same time, making sure you're up on a prebiotic and a probiotic so that you're trying to constantly introduce good bacteria, and understand that there are consequences. That's an important question for the doctor to answer to you. How do I protect my good bacteria while I'm on this embedded infection? And how can I reduce my risk of C. diff, Clostridium? Let's see how they answer that. I mean, generally people are saying now that antibiotics are prescribed for too long, that a shorter period would be less traumatic to the body. And what the chronic people are saying is you got to take it for a long period of time. And it's going back to the old Fukuzawa research, and it's controversial. It is absolutely controversial. Aaron, so every week you have a urine test and you're always positive for nitrates. If you're always positive for nitrates, you have infection. You have bacterial infection. If you're positive for leukocytes, then that could easily be a flare. But nitrates are only produced by bacteria. So if you're positive for nitrates, that tells me you've got something going on. And Aaron, I would be having that next generation urine test. I would want to see the results of that and see what they find. Susie, I'm not familiar with that. You're using Body Bio PC phosphatidylcholine. Interesting. I don't know what that does. Gwen, have they ever tried putting a probiotic in the bladder like a dilation? I'm sure somebody has. I mean, for some patients, they're treated with a bladder installation containing an antibiotic. I don't know if people have put a probiotic in there. Yeah, lemon balm tea is awesome. Lemon balm tea is a mint. It is not citrus lemon, and it can be very calming and soothing to nerves. Also, L-arginine, guys. In our magazine, I share and I don't know if Donna is still in here. Donna Chippendale, are you still in here? I don't know if you're still in here or not. I had a patient story I wanted to share with you. So one of the stories that I'm featuring in this latest magazine is a woman who was quote unquote diagnosed with IC. Her pain was very, very severe. Nothing worked for her. She was absolutely exhausted. And she started researching and learned about pudendal neuralgia, had an x-ray, and what they found was that her tailbone was curved in the wrong direction. And there was a substantial curve to it. But the doctor really didn't, so he was like, oh, well, that's odd. That's unusual. But he was like, and she was like, well, could this be causing my pelvic pain? And he's like, I don't know. And then she went to a chiropractor, and the chiropractor looked at it even more and was just stunned at how out of place her tailbone was. And she had 22 chiropractic treatments over a couple of weeks. And she is massively improved now. And she's even had a baby. And she goes back every couple of weeks to the chiropractor. And so her pudendal neuralgia was somehow her tailbone was pushed out of place and was compromising nerves. Fascinating. Kathy said, is anyone familiar with the use of methenamine hippurate to prevent chronic resistant E. coli infections that seem to stem from IC with Hunner's lesions? Methenamine is common, but it's usually not meant to be taken long-term. It's had many brand names over the years. It's like, yeah, for 5 years you got one, and then it changes. You're a blue, you're a SED, all those. D-mannose is a less toxic non-medication approach to preventing the growth of E. coli. But remember too, that if you are menopausal, so a menopausal woman is going to be far more prone to infection. Why? It gets back to this mucus layer here. This is a barrier not only for irritants in your urine, but for bacteria. So if you have this big barrier, it's hard for bacteria to reach these cells to infect them. But of course, if you're menopausal, bam, you have much less mucus, which means bacteria can reach these cells and infect them. So a critical part of treatment for this, Kathy, if you're of age and estrogen deficient, is also using an estrogen cream vaginally to try to deliver some estrogen to your bladder to plump up that mucosal barrier. A menopausal woman with recurring UTI, it is never diagnosed as a simple UTI. It is always diagnosed as a complex UTI, and usually they will also give you a hormone product also. All right, it's time for free giveaways. It's time for free giveaways. So I'm going to write down a number between 1 and 100. Okay. And whoever gets the closest is going to get, we'll do the coffee first. Coffee first. So you can vote as many as your time. Pick a number between 1 and 100, and whoever gets the number first will get a free thing of Tyler's No Acid Coffee. Rima, remind me, we're going to come back to Cymbalta, okay? Okay, guys, go ahead and vote. I'm looking at your votes. Nobody is. One person is 3 off. That's all I'm going to say. Sue Gilbert wins. Sue Gilbert. Sue Gilbert. The number is lucky number 3. So, Sue Gilbert, I need you to send me a private message. I think you're a friend of mine on Facebook. If you can send me your address, I will send you tomorrow some Tyler's coffee. How does that sound? All right. Our next giveaway. Our next giveaway is for the book When It Hurts Down There, the best book I have ever read on how to control pelvic pain. It is fantastic. It has completely changed my life, though I'm applying some of these things here. And one of the things I love about this book, it's hysterical. She says, because she talks about how to interfere with pain processing, she's used foul language when the pain is really intense. If you've ever hit your thumb with a hammer or stubbed your toe on a table, you've probably sworn or at least wanted to. This kind of reactive vocalization starts in the lower brain gateways. It's a spontaneous reaction to pain, and it actually reduces the pain signal. Now, I'm not suggesting picking up a general expletive habit. This only works well when you're not accustomed to using foul language regularly. And if it's against your morals, then certainly don't do that. But anyway, that's an entertaining thing here. So you have my permission to cuss every now and then if you need to cuss. All right. So I am writing down another number. I wish I could do something other than a number. Anybody think of a contest other than a number? A letter? Okay. Hold on. And I've been told some of you can actually predict what I'm writing, which is why I'm writing multiple numbers in case you're looking at arm movement. I don't know how the hell you do it, but some of you do. All right, so let me move down here. Oh, animal. Oh, color. Okay, stop voting. Everything you just did, well, I'm not counting it yet because I didn't tell you to start voting yet. Okay, so everybody stop your voting. You're going to vote again. So stop voting right now because you started before I was watching. No more voting. Aaron, Sue, stop. No voting right now. I'm going to address the Cymbalta issue and then we'll vote. So stop voting. Stop voting. Stop voting. Oh my God, you guys. Somebody asked about, is there good results with Cymbalta? Cymbalta is a new type of pain medicine. Unfortunately, if you are pondering Cymbalta, you need to research something called Cymbalta discontinuation syndrome. When you take Cymbalta, yes, it might be helpful, but there's going to come a time when you want to get off of it. And the problem is getting off of it is extremely difficult. And we just had an FDA alert about an over-the-counter antihistamine Zyrtec that is doing exactly the same thing. When you get off of the medication, you can have hallucinations for months. So there is something deeply flawed about Cymbalta and Zyrtec. One of the challenges is normally when you go off a medication that that you are tolerant to, you would gradually reduce the dose. You would go from 10 for a week to 10 milligrams to 8 milligrams to 6 milligrams to 4 milligrams, etc. And I seem to remember when I did my research on this 4 or 5 years ago, the problem with Cymbalta is the manufacturer did not make a low dose. And so you were like literally at 20 and you couldn't titrate down. And as a result, you ended up going into a complete absence and the body reacted with this terrible discontinuation syndrome effect. So Cymbalta discontinuation syndrome, Zyrtec discontinuation syndrome is something you should know about if you are considering taking that medication. I, for one, would not take it. I'm just telling you right now, knowing me and my sensitivity to meds, I don't want to hallucinate for 3 months. It's brutal. The patient stories out there, absolutely brutal. Okay, now we're back to this. Pick a number between 1 and 100. Go. Okay, you can now start voting. If you want the book, start voting now. Obviously, there's a delay. I don't know how long the delay is. It's like it's a minute. Okay, so the first person who gets the number gets the book. Keep going. You can vote multiple times. One of you is very close. Not yet. Keep going. Not yet. Nope. 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 Come on, guys. It's a free book. For goodness sake. You can vote multiple times. It's okay. Oh, one of you is one off. We'll do this for one more minute, and then I'll go to the person who was the closest. Not yet. See, don't you wish you had a photographic memory and you could just remember all the numbers that people have said so far? So you know the ones that weren't said? Nope. 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 Oh, you guys. A couple of you have been one off. Oh my God, you're killing me. You're killing me. Oh, literally. Okay, this is hard. Come on, somebody do it. Okay, I'm going to scroll back. I'm going to make sure. Keep voting. You guys are like dancing around the number. Oh, oh, oh my God. Yes. Aaron Glidden. 97. Aaron Glidden, my dear. that was an effort. Leanne Ballard. Man, you danced around it. You did 98. I think you did 96. I was going to give it to you until she did it. Oh my God. Now, guys, you can buy this book right on our website. And if you come back to other meetings, I will give it away. We give it away again. It's worth $25. And it's just a really, 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 really good book. Okay. And if I missed it, if somebody else said 97 and I missed it, let me know and I will find another book and send it to the other person who said 97, but I'm pretty sure I didn't miss it. All right. Okay, my friends. Well, listen, we have been doing this for 3 hours. Holy moly, can I talk? I always end these meetings with a very important message. And if there's one thing that I want you to remember from this right now is that this is not your fault. You have done absolutely nothing wrong. There is no shame. There is no blame. I don't want you carrying a burden on your shoulder. I don't want you thinking that you're damaged goods. I don't want you thinking that you're unlovable or you're worthless, because that couldn't be farther from the truth. You are no different than someone who is hit by a car. You deserve the love and attention of your family and your friends. What's hard, though, is we hide it. And you know, I'm a woman, but you know what? Guys do it too. There's something about us. We let it get to us. We start thinking that we're damaged goods. We start thinking that we're unlovable. We start thinking that our partner deserves someone better. And that's just baloney. Listen, if your husband had prostate cancer, you would drive him to the hospital. You would sit outside. You would hold his hand. You would bring him home. You would feed him his favorite foods. You would love on him like you have never loved on him before. Right? Because you know he's hurt. And the same is true if the IC patient, if it's your wife. The love that you would give to them is the same love you deserve in return, but you're not going to get it if you don't ask for it. And you tell them that you need help. And I need you to do that. I need you to be honest. Don't hide it. I once had a doctor. There was a doctor in Marin County, California, who told a man with severe pain not to tell his wife that he was in pain. He told him to be a man and to buck up. And for 5 freaking years, that man suffered without the love of his family. And it just broke my heart. And I think I told you, the single most important phone call I have gotten from the IC network, and we get 20 or 30 a day, was from a man who was sobbing. Like, I answered the phone. Hi, this is Jill from the IC network, because you know what, guys, I really do answer the phone. You're all surprised when I answer the phone. It's like, yeah, no, I do. Don't have a secretary. It was a man sobbing. And I whispered to him for about 5 minutes, just listen, just calmed him down, we did some deep breaths together over the phone. What he said stunned me. He said, I am the chief of one of the biggest trauma units on the East Coast. And I have IC, and I have bladder pain, and I've told no one. I've told no one at work, because the minute I do, they will laugh at me, and I will lose my professional reputation, because they all think IC is mental. And then he started crying again, and he said, I can't do it anymore. I can't do it anymore. That's how a doctor felt. Can you believe it? And I created, we had for about a decade, a doctor and nurse only, medical care provider only support forum where they could participate anonymously. When you look at the professions of people who have IC, number 1 is teachers, and number 2 is medical care providers, nurses, and doctors. Okay, why? Because their restroom access is restricted in both of them. I think that's a big part of it. Being able to use a restroom and drink plenty of water, I think, is a normal part of urinary function. But anyway, so getting back to my point here is, I don't want you to suffer in silence. I want you to ask for help when you need it, with no shame or no blame. And if somebody in your family doesn't understand IC, you print out the AUA guidelines, 60-page, make them read it. Read it. Look at all the research studies. I'm telling you right now, the federal government wouldn't have put $100 million into studying IC if it was fake. The other thing what I say to people who have the audacity to suggest it's all in your head, what I would just say is, well, then why is my bladder bleeding? How could a mental illness cause my bladder to bleed? Right? Right. Stunning. So, Kelly, you're welcome. Yeah, I know. I have to say it to myself too. I have one of the things that I did. Where is it? Where is it? I'm not saying this is easy. Okay, this is hard. It is hard to keep yourself calm and collected when you're in pain. It is hard not to be discouraged. It is discouraging when you have a flare over and over, or you eat the same food over and over. But what I don't want you to do is, I don't want you to let your thoughts make you more depressed. You got to have a goal. If you spend every day thinking, my life is terrible. I'll never get better. Nobody loves me. I have no friends. I mean, you're just going to spin in this vicious, awful cycle. So one of the things that I kicked in early, of course, it helped that I have a master's degree in psychology, is I started my day with affirmations. Now, you know me, okay? You know that I am an extremely positive person. My magazine, which you can see on the wall, is called The Icy Optimist. How the hell can you be optimistic when you're in pain? A lot of it begins with what you say to yourself. It's very important that you address your inner language. If you're saying, I am a bad person over and over and over, I'm unlovable over and over, you're going to program yourself to think that. So I'm going to tell you some affirmations that I think you should say every day. You need to write them. You need to write them on Post-its and put them on your mirror. You know, one of the things that I have as an example is I have things like this all over my house. I believe. I need constant visual and audio happy things so that, I mean, because think about it, man, I'm working with people who are crying every day. If I didn't do this, I would be crying every night. But I love my job. And one of the reasons I love my job is I got good balance there. So affirmations. So I'm going to read off some affirmations and they're in our magazine. So for those of you who are subscribers, you're going to get them. Every single day, I want you to say, healing is always happening. Because it's true. Healing is always happening. It never turns off. Your bladder's trying and your muscles are trying to fix things. Okay, healing is always happening. I am confident. I am relaxed. I deserve the best care available. I am proud of the person I am today. I am working hard to heal. I am an asset to my family. I can do all things through my faith, which strengthens me. And you can insert whatever faith you have. Every day, in every way, my life is getting better. Here's one of my favorites. That which is done for you, let it be done. That which you must do for yourself, do it. Be bold, and mighty forces shall come to thy aid. I was doing that in the car the other day because I'd been to the gynecologist for my yeast infection and I was feeling really good. And then I had to drive 20 miles with a yeast infection. And all of a sudden I was kind of like, not so good. And I kept saying, I can do all things through Christ who strengthens me. Or be bold and mighty forces shall come to thy aid. I am strong today. I will find the strength to do new things. I am an important part of my family. I am gentle and kind to those around me. I will commit one random act of kindness a day. I walk with peace today. I will help at least one person today. I choose to focus on the future, not on the past. I am peaceful, even when life is hectic. This flare will not control me. My bladder will not control me. My pain will not control me. Every day I am getting healthier. I choose not to be angry today. I choose kindness. I forgive those who do not understand my life. I will help my family heal. I love watching my positivity help others. So you'll find that list in our magazine. And always, every single day, you have an action plan. Action plan number 1 is what can you do today to soothe your body and your bladder? Use a heating pad, take a warm bath, use some medication, rest, take a nap, take a walk. Do something for 15 minutes that you know will help your health. Drive by Starbucks instead of stopping at Starbucks. Pass on the chocolate and, get a piece of celery or whatever. Number 2, what can I do today to lighten my heart? What can you do today to soothe your spirit? Call a friend or a family member, take a walk, love on your dog. Just do something that will give you comfort and nurturing. Take a walk through the redwoods if you have redwoods. And what can you do today to build your knowledge about your health? Because seriously, that's, I think, our biggest barrier right now is, especially with the next generation, is they're simply not reading. They're not reading hardly anything. And you're getting a lot of people are getting all their information off social networking. And it doesn't work that way. You got to build your skills. You got to build your knowledge. So every day I want you to read one blog about IC. If you're bold, you'll go get the AUA guidelines, read them. Read one page a day, for God's sake, one page. It's not that hard. If you're a nerd like I am, go to the National Library of Medicine, pubmed.gov, search for IC, read one article a day, one abstract a day, but do something to bring your knowledge level up. Because I'm telling you, as I've said before, no one can mess with me about IC anymore. I will smack them down with research. Smack them down. And I want you to be able to do the same thing. Okay? I want you to be able to do exactly the same thing. So, all right, my friends. Oh, my boss said he didn't know why I didn't smile and used it against me. Yeah, that's kind of, you know. So we got to find that inner smile, give yourself something to laugh about, give you something that lighten your heart, distract you from that pain, all that sort of stuff. So, all right, my friends. Hi, Rima. Nice to see you. Kyle, so important. It's amazing. In fact, I got to tell you, I was working with a urologist who finally, for the first time, became a patient. And I asked him, so how long did it take before you got disrespected by your peers? And he was like, yeah, I totally see what you're talking about now. So it's amazing how hard doctors are on other doctors and nurses are on other nurses and so forth. It's amazing. Kathy, you guys just remember, because we're coming to a close now. It's been 3 hours. My voice is going to give out soon. Come to our website, ic-network.com. And also, if you want to talk, I'm happy to talk to you. 1-800-928-7496. We are getting a ton of phone calls now. If you get my voicemail, it means I'm working with another patient. It might take 24 to 48 hours for me to give you a call back. Fair warning, if you're on the East Coast, I will be calling you back at night. Because for me, I work till 5:30 Pacific, which means that's 8:30 your time. So be prepared for the fact that I might call you back later if you're on the East Coast, okay? If you want to get ahead of the list and you don't want to wait, we have wellness coaching you can sign up for too in our store, all right? But we really do try to take all your questions. All right, my friends. See you later. I'm going to go watch the Fortnite tournament on Twitch after I get something to eat. So I'll see you guys later. See ya. Bye-bye. Hello and goodbye, YouTube. See you later.